Sergeant at Arms will kindly assist you. Thank you very much for your kind cooperation. Chair, we're ready to begin.
Thank you. Good morning, everyone. My name is Lynn Schulman, Chair of the New York City Council's Committee on Health. Before we start, I want to dedicate today's hearing to former Councilmember Paul Vallone, who unexpectedly passed away earlier this year and who is an especially devoted animal advocate. I want to thank everyone for joining us at today's important and long overdue hearing on the state of animal rescue in New York City. We will also be hearing introduction number 1018, sponsored by Councilmember Brannan and myself, which would implement the state's prohibition of the sale of cats and dogs in retail pet shops and require that any person who sells animals to the public in their ordinary course of business receive a permit to do so from the city's health department. Before we begin, I would like to note that we are joined by Council members Zhuang, Marmorato, Areola, and of course, Councilmember Brannan. Today, we will be discussing the current state of animal rescue in New York City. Animal welfare is a fundamental aspect of our community's health and compassion, and at this hearing, we will be examining how the city is meeting these responsibilities. We will hear testimony from the Mayor's Office of Animal Welfare, the Animal Care Centers of New York City, also known as ACC, the Health Department, and the many animal welfare and rescue organizations, individual rescuers, and animal advocates in the city who have dedicated their life to this work. I also want to thank the ASP work they do to help our city's animals and pet owners. And by the way, the ASPCA is outside City Hall today showcasing some wonderful animals they have up for adoption, so please stop by if you can. I believe they're here until noon today. As chair of the Health Committee, I am committed to making sure that the city is providing enough resources and support to address this issue, and we will use this hearing as an opportunity to explore ideas for potential legislation and identify actionable steps to take to enhance these efforts. Over the past 2 years, New York City reached an alarmingly high rate of pet surrenders following the surge in adoptions during the COVID-19 pandemic. At the same time, the number of adoptions from ACC and other organizations has largely decreased. In 2018, about 700 dogs were adopted per quarter from ACC shelters, and in 2020, that number dropped to 180. In the first quarter of 2024, there were a little over 300 dog adoptions from ACC, which is not even half the pre-pandemic rate. During that same period, ACC took in about 7,500 animals, a 33% increase from 2021. ACC has been a critical player in managing animal intake, providing shelter, and working to find homes for our city's animals in need. But their facilities and staff are being stretched far beyond their capacity. We must understand both ACC's successes and the challenges they face to ensure that every animal receives the care that they deserve, which includes determining whether sufficient funding and resources are being allocated to them. ACC is not the only organization doing this valuable work. I want to thank the numerous rescue organizations and independent rescuers throughout the city who dedicate their time and resources to this issue, including the organizations that I have visited over the past few weeks. It is vital that we recognize all their invaluable contributions and explore how the city and ACC can support them better. This is especially true for those who volunteer in feral cat colonies around the city. These rescuers face substantial challenges. They lack adequate resources, funding, and most critically, access to low-cost and high-volume spay and neuter services, which is very necessary to make a meaningful impact on stabilizing the feral cat population. New York City stands significant funding to government programs that provide access to low-cost spay and neuter procedures for both pet owners and rescuers. Access to low-cost and affordable veterinary care is one of the main drivers of pet surrenders and the decline in adoption rates nationwide and in New York City. According to the New York Times, the cost of veterinary care in the United States has increased by 60% over the past 10 years, outpacing inflation. This is due to various factors such as an increasing shortage of veterinarians and technicians. A national survey showed that about 1/3 of pet owners report avoiding going to the vet due to financial constraints. And according to Forbes, New York City ranks number 6 among the most expensive cities to own a dog. This is not acceptable. Another increasingly prevalent problem is people surrendering their pets due to housing challenges. In New York City, it is becoming harder to afford housing and find housing that allows or is suitable for pets. When tenants move to new rental properties with strict pet regulations, they often face the heartbreaking choice of whether to give up their beloved pets, a choice that no one should have to make. According to the organization Voters for Animal Rights, New York City's spending per capita on animal welfare is far lower than the amount spent by cities such as Miami, Dallas, and Los Angeles. New York City has a long history of being a national leader in the implementation of innovative policies. We need to ensure that city resources are being adequately provided as well as funded, but we must also address the root causes of these issues and not simply put a bandage on a deep wound and hope for the best. In conclusion, I would like to thank the members of the administration who are present today, as well as ACC and all of the organizations and animal advocates who are here to make their voices heard. We appreciate your time, but kindly request that members of the public be patient and adhere to their allotted testimony time so that everyone has an equal opportunity to testify. I would also like to thank my staff and the Health Committee staff for their work on this hearing. I will now turn it over to Councilmember Brannan to make a statement on his bill, introduction number 1018. Councilmember Brannan.
Thank you, Chair Schulman, and thank you for convening this very important and long overdue hearing. And I appreciate you hearing my bill today. They say that the moral progress of a society can be judged by the way its animals are treated, and I think we're here today because we can all agree that the greatest city in the world needs to do a much better job at being the most humane city in the world. And I've been an animal welfare advocate since I was 13 years old. I'm now one of 51 lawmakers in the city of New York and in a position to do something about it. I'm often the first to defend the fiery passion of animal activists when others assume that there's some sort of ulterior motivation. There is no ulterior motivation. We just all really, really care about animals, and we want to get this right. And not just only on my bill, but on the hearing today that Chair Schulman has convened us for. I think the mayor talks a lot about going upstream. Instead of waiting to pull people out of the river, we should go upstream to find out why people are falling into the river. And I think we can do the same when it comes to animal welfare in the city. And the fact that, as Chair Schulman mentioned, that so much of our overcrowded shelters are due to the lack of veterinary care and the lack of subsidized TNR resources. And I am worried that the city of New York right now is taking advantage of, if not exploiting, the compassion of animal lovers. We all care very much about animals, and we're always going to do everything we possibly can for animals, and even if it comes down to spending our last dime, we're going to use it to buy cat food for our feral cat colonies. But the city should be helping and subsidizing these actions. So, but the bill that we're hearing today has been a very long time coming, working with our partners in Albany as well to prevent the sale of cats and dogs in retail settings. I've only ever adopted and had adopted pit bulls, and now I have an adopted racing greyhound. And adopting an animal is, you save 2 lives. You save your own, and you save the life of that animal. So with pushing this bill today and with all the issues that I think will help aerate today, this is going to be an important hearing, and I want to thank Chair Schulman for putting it together, for hearing my bill, and most of all for the administration for being here, but for all of you for being here today with us and doing everything we can to make this a more humane city. Thank you. Thank you, Chair.
Thank you, Councilmember Brannan. I will now turn the mic to the committee counsel to administer the oath to the administration.
Good morning, Chris Pepe, committee counsel. If you could all please raise your right hand. Now, in accordance with the rules of the council, I will administer the affirmation to the witnesses from the mayoral administration. Do you affirm to tell the truth, the whole truth, and nothing but the truth in your testimony before this committee, and to respond honestly to council member questions? Director Silver? Okay. Swinsock? And Deputy Commissioner Schiff. Okay, you may proceed with your testimony. Thank you.
Before you start, I just want to tell people there's really no clapping in the chambers. You can go like this if you agree with something. Thank you very much, and if we can keep it down so that we can get through everything, I appreciate it. I appreciate everybody being here. Thank you. I'm sorry.
Thank you. Good morning, Chair Schulman, Councilmember Brannan, and members of the Health Committee. My name is Alexandra Silver, and I have the honor of serving as Director of the Mayor's Office of Animal Welfare. I'm joined by Risa Weinstock, President and CEO of Animal Care Centers of New York City, ACC, and Corinne Schiff, Deputy Commissioner for the Division of Environmental Health at the Department of Health and Mental Hygiene, both of whom will also offer testimony. I am grateful to the City Council for recognizing that animal rescue is a significant subject worthy of government's attention, and I thank you for the opportunity to speak today. New York City has had an animal welfare liaison in the mayor's office since 2015, and since 2020, the first mayoral office of animal welfare in the country. By creating this dedicated entity, and I thank Councilmember Brannan for his bill calling for it, and the council for their support, we have elevated animal welfare considerations in city government and can stand as a model for other municipalities. There is much potential for growth, but I am heartened by this office's ability to connect with agencies across the city on a wide variety of issues affecting animals and, by extension, affecting people. The well-being of animals does not exist in a vacuum. It is both impacted by and impacts many factors, and it is linked with the well-being of people. Animal shelters, rescue groups, and individual rescuers in New York City and across the country are experiencing challenges that reflect broader issues. When we talk about animal rescue, we are talking about financial pressures and housing challenges facing animal guardians. We are talking about veterinary workforce shortages and lack of access to resources for people with pets. As liaison for the city regarding animal welfare needs and concerns, I hear from and speak frequently with New Yorkers directly involved in animal rescue. We are fortunate in New York City to have many wonderful nonprofit organizations and compassionate individuals committed to helping both animals and the people who love them. One of those organizations is Animal Care Centers of New York City, which is contracted by the New York City Health Department to operate our city's open admissions animal shelters, and which also partners with an impressive network of other animal welfare organizations. As I stated the last time I appeared before this committee, and I wholeheartedly reiterate now, the Adams administration appreciates the hard work and dedication of ACC staff. It is essential that we continue to support ACC, and all New Yorkers can join in their mission of ending animal homelessness by adopting, fostering, volunteering, and encouraging others to do so. This administration is committed to helping get that message out, sharing information about adoption and fostering opportunities in newsletters and social media, including dogs available for adoption from ACC partners at press events, and facilitating opportunities for ACC to conduct outreach. Mayor Adams has hosted and participated in Kitty Hall and City Howl adoption events at City Hall, joined in the opening of the new Staten Island Animal Care Center, and filmed videos to help promote the importance of adopting, fostering, and volunteering. In our recent Summer of Possibility campaign, highlighting various activities and resources, we included adopting a pet, with the campaign landing page linking to ACC's website. Adopting a dog, cat, rabbit, or guinea pig from an ACC shelter is now something that Queens residents are, at long last, able to do in their own borough, along with looking for their lost pets. Earlier this week, we celebrated the opening of the Paul A. Vallone Queens Animal Care Center, the first full-service animal shelter in Queens. It was wonderful to see Chair Schulman there, and we thank the council for all they did to make this center a reality. I know I am far from alone in wishing that former council member Vallone, whose compassion for and advocacy on behalf of animals was an inspiration, that he could have stood with us to cut the ribbon. Those of us who are familiar with the older centers, built in and for another century, can most appreciate the progress this new facility reflects. On a recent visit, I almost jumped for joy when I saw a sign by a room in the medical department that said dentistry. People who work and volunteer at ACC and in animal rescue understand why this is so exciting. I am thrilled by the rooms accommodating multiple cats, enabling them to socialize and explore, and the retractable skylight over many of the dog kennels, allowing for light and fresh air. We are aware of some recent concerns regarding conditions at the new center, but it is truly a remarkable, beautiful building that will make for a better animal, adopter, pet owner, employee, and volunteer experience. Meanwhile, the New York City Department of Design and Construction is managing ACC capital projects at 3 other sites. Construction of the new full-service Bronx Animal Care Center is moving along, and as a center, when it is complete, it will bring an essential community is undergoing a total renovation, and the new Manhattan Pet Adoption Center is anticipated to open this fall. We mark the opening of the current Staten Island Animal Care Center in 2022. In coming years, we will have full-service animal shelters in every borough and welcoming facilities that will vastly improve the adoption experience, encouraging more New Yorkers to play a part in animal rescue. This is an essential component to ensuring the safety and well-being and welfare of companion animals in New York City. But, as stated earlier, animal rescue is part of a larger ecosystem. And in addition to improved facilities and promoting pet adoption and fostering, we must do what we can to prevent animals from needing shelter and rescue in the first place. Leaders in the animal sheltering field across the country are emphasizing the importance of keeping pets and people together, thereby reducing shelter intake. Doing so means helping animal guardians access resources and doing our best to adjust policy so that they reflect our understanding that pets are family. Mayor Adams' 2 appointees to ACC's board of directors have each demonstrated a deep commitment to helping people and pets stay together. Prior to focusing on such efforts in her current position with the Humane Society of the United States, Aaliyah Simpson helped build ACC's surrender prevention program. Christine Kim, who was the first director of the Mayor's Office of Animal Welfare, is the founder of My Dog is My Home, a national nonprofit organization that highlights and helps preserve the bonds between people experiencing homelessness and their companion animals. We marked a milestone in New York City just this spring when the Department of Homeless Services joined with the nonprofit Urban Resource Institute, URI, to launch a pet-inclusive pilot program at a shelter for families experiencing homelessness, ensuring their 4-legged family members can be kept with them. URI has led the way in keeping families together with their people and animals living safely, PALS program, at many of their shelters for survivors of domestic violence. Also this year, the Mayor's Office of Animal Welfare joined the newly created Tenant Protection Cabinet, which aims to better serve tenants by creating pathways to renter-focused programs and services and to ensure safe and fair housing conditions. Our office was eager to take part in such a cabinet, since housing-related challenges are a major contributor to the high populations that animal shelters across the country are experiencing. One of the initiatives that the cabinet is working on is a flyer to raise awareness specifically about protections for tenants with pets and assistance animals. The Office of Animal Welfare is also exploring ways to make housing more pet inclusive, more accessible to people with pets of all sizes, for example, to begin with. Doing so would not only enable more animals to stay with their families who already love them, but also widen the pool of potential adopters. Efforts to keep pets and people together can also help address New York City's overpopulation of outdoor cats without owners, as it is likely that some of those community cats would have remained inside if families had had access to resources to care for them. Among the places community cats call home are New York City Housing Authority, NYCHA, developments across the 5 boroughs. At the end of last year, NYCHA awarded a contract to a leading New York City cat rescue organization to provide trap-neuter release, also known as trap-neuter return, or TNR, services to help manage this population. This is an important step. As noted in our 2023 annual report, Addressing street cat overpopulation requires a multifaceted approach, and it is essential that New Yorkers who have cats get them spayed or neutered and not let them roam outside. We recognize that affordable spay-neuter resources in New York City for both owned and community cats are limited, and we continue to explore ways to improve accessibility. Access to affordable veterinary care in general, not just spay-neuter, is also very much on our radar. This is a challenge for animal guardians, rescuers, and shelters across the country as we face not just high costs of care, but a veterinary workforce shortage as well. City funding for the new Queens ACC includes more than $1 million for a veterinary clinic that will serve pet owners who, but for assistance with veterinary care, would have to relinquish their animal to ACC. Such a clinic is another significant step. We have connected with those who run existing nonprofit clinics for companion animals, veterinary practitioners, LaGuardia Community College's veterinary technician program, and others invested in access to care, and we will continue to engage on this. Earlier this year, Mayor Adams met with a Long Island University College of Veterinary Medicine student who had been awarded a scholarship designed to enhance diversity within the veterinary profession. This scholarship, facilitated by the administration, was made possible through the efforts of the Brady Hunter Foundation and Harlem Week. Ultimately, helping more animals means helping one another and coming together as a community to address several long-standing and deeply rooted issues. We plan to sponsor capacity building workshops and trainings tailored to animal rescue organizations to learn more about opportunities for securing city funding, as well as to explore existing avenues for public funding. The office has also encouraged and will continue to encourage nonprofit organizations involved in animal rescue to register and share foster and other volunteer opportunities on the NYC Service website. Organizations can also post in-kind donation wish lists on the platform, where we are eager to see more animal welfare organizations represented. Circling back to the role pet adoption plays in animal rescue, animals, rescuers, and shelters would benefit greatly if more people chose to adopt. We expect and are hopeful that the significant New York State legislation prohibiting the sale of dogs and cats in retail pet stores, which takes effect this December, will contribute to increased adoptions. We are interested in learning more about the council legislation currently under consideration, Introduction 1018, which also addresses the sale of animals, and look forward to discussing details of this bill further with you. Thank you for your attention and support in addressing animal welfare. We look forward to your questions and continuing our collaboration to improve the lives of animals across New York City. I will now turn it over to Risa Weinstock of ACC.
Please go ahead. Before you do that, I want to just acknowledge we've been joined by Councilmember Holden.
Good morning, Chairperson Schulman, members of the Health Committee, and City Council. My name is Risa Weinstock, and I am the President and CEO of Animal Care Centers of New York City. Thank you for the opportunity to testify today. I'd like to thank the City Council, the administration, and the Department of Health and Mental Hygiene for the commitment to ACC and the health and welfare of New York City's shelter animals with the addition of new full-service care centers in Queens, the Bronx, and Staten Island, and a complete renovation of the Brooklyn shelter and the addition of a pet adoption center in Manhattan. With this substantial support and support from the private sector, ACC continues to grow as a national leader for open admission animal shelters. Established in 1995 as a 501c3 not-for-profit organization, ACC has been dedicated to rescuing, caring for, and finding homes for New York City's homeless and abandoned animals for almost 30 years. Over the last decade, we have expanded our services beyond the four walls of the shelter and into the community, identifying root causes for animal surrender or abandonment, and targeting community needs rooted in surrender prevention and preserving the human-animal bond. Our services in our care centers and in the community are the foundation of our mission to end animal homelessness in New York City. ACC is unique among all other animal welfare organizations in the city in that we are the only open admissions organization. Under our contract with the city and the health department, ACC accepts every animal brought to us, whether the animal has been abandoned, surrendered, or found as a stray. Since January of this year, ACC has taken in over 13,000 animals. To date, with the combination of our adoption program and a robust partnership with over 300 rescue groups in our New Hope program, ACC has been able to place 91% of cats, dogs, rabbits, and guinea pigs that have come through our doors. Animal shelters nationally are navigating many post-COVID challenges that are dramatically and negatively impacting animal welfare. Adoption alone will not solve these issues or alleviate the strain on our shelters. Community support and collaboration with the common goal of achieving the best outcomes for the most animals is necessary. No one organization can fix what is happening, but all of us working together can certainly lead to a stronger state of animal welfare in New York City. The two main drivers of animal intake at ACC are owner surrender and stray animals. The common thread to these intakes is financial hardship, job losses, housing instability, pet restrictions in housing, the rising cost of basic pet care, pet food, and veterinary services. We have dedicated significant resources to provide social services to assist thousands of pet owners in successfully keeping their pets. Yet other constraints, like pet restrictions in rental homes and apartments, and pet fees on top of an increasingly unaffordable rental market, and the rising cost of veterinary care, leave our clients with no option but surrender. These are not issues that ACC can solve alone. There's also been an uptick in stray animals brought to ACC. These are the hardest to place animals because we have no access to important information like their temperament, their behavior, or any latent health issues. As we take in more stray cats and dogs, the amount of time spent in our care center also increases. That is because so many of these animals we take in are not spayed and neutered, and by law, ACC must sterilize cats and dogs before releasing them to adopters or rescuers. While there was a significant increase in pet adoptions during the height of the pandemic, when many people were spending more time at home, the national trend, as well as in New York City, is that the rate of adoption is declining. As people return to more regular work away from home and their social routines, fewer individuals are looking to adopt pets, leading to longer stays for animals in shelters. For the same reasons that lead to surrender, the rising cost of pet care and a crisis of affordability of housing and daily goods have all added to lower adoption rates. There is also a very critical nationwide shortage of veterinarians and veterinary technicians. Affordability and availability of care have resulted in many pets going untreated for basic wellness issues to more serious conditions. At ACC, many of our clients cannot afford care. This is specifically why our surrender prevention program was implemented. We offer an array of resources, including a pet food pantry, counseling, free and local vaccine clinics, vouchers for free or low-cost spay-neuter, and medical services. With the addition of 2 clinics as part of our shelters in Queens and the Bronx, we will be able to increase pet retention by offering access to low-cost veterinary services to our clients who may need to surrender their pet because of an inability to pay for needed veterinary care. Even with these challenges that I've outlined, ACC remains optimistic about our future and the potential to better serve the homeless and abandoned animals of New York City. Earlier this week, we officially opened the Paul A. Vallone Queens Animal Care Center. This large and modern facility provides an abundance of natural light throughout the building, a state-of-the-art medical suite with sophisticated and modern medical equipment like an X-ray machine and a separate suite for dental work. In May of 2023, the city also broke ground on a brand new animal care center in the Bronx. Like Queens, this shelter will be the very first of its kind in the borough. Soon, the city will also cut the ribbon on a new adoption center next to the Manhattan Care Center. And finally, the Brooklyn Animal Care Center is undergoing complete renovation. The upgrades are part of the administration's and ACC's mutual commitment to providing the best possible environment for the animals in our care and enhancing the services we offer to the community. Once construction on all these new and innovative buildings are complete, the Council and New York City will have fulfilled the late Paul A. Vallone's commitment and promise to New Yorkers, a full-service animal shelter in every borough. ACC is grateful to be part of that reality and is committed to ensuring the best outcomes for the most animals in partnership with the animal welfare community of this great city. In closing, I want to express my gratitude to the City Council and for its continued support of ACC. We're committed to our mission to end animal homelessness by being a resource for the community and ensuring that every New Yorker has access to the resources they need to adopt a pet or to care for their pets long-term. I invite the Health Committee and all members of Council to come for a tour of our centers, meet our staff, attend one of our community pet vaccine and wellness clinics, or simply adopt or foster from one of our shelters. We have all kinds of dogs, cats, rabbits, and guinea pigs to choose from. I am certain we can make a good match for you. A visit to any of our care centers will give context to my testimony, but also will help you see firsthand the challenge and the meaning of our work and the positive impact that ACC is making on pets and people of New York City. In fact, individuals who want to make an impact right away are encouraged to attend our online dog foster orientation this Sunday. More information and sign up is available on our website at nycacc.org/foster. I welcome any questions you may have, and I look forward to working with you to improve the lives of animals and pet owners across New York City. Thank you.
Go ahead, Commissioner.
Good morning, Chair Schulman, members of the Health Committee, and Council members Brannan, Holden, and Brewer. My name is Corinne Schiff, and I'm the Deputy Commissioner for Environmental Health at the New York City Health Department. On behalf of Commissioner Vasan, thank you for the opportunity to testify today. The Health Department is charged with overseeing a range of animal-related activities. We permit and inspect facilities such as animal shelters, grooming facilities, pet shops, boarding establishments, and animal exhibitions. We conduct training on small animal handling, issue state-mandated dog licenses, investigate animal nuisance complaints, animal bites, and dangerous dog incidents, fund low-cost spay-neuter services, monitor wildlife and domestic animals for rabies, and undertake rabies prevention activities. The Health Department is also responsible for managing and caring for the city's population of owners surrendered, abandoned, homeless, and lost animals. The department carries out these responsibilities by contracting with ACC to provide services Ms. Weinstock described in her testimony. We were excited to celebrate the opening of the beautiful Paul A. Vallone Queens Animal Care Center with you, Chair, along with ACC, the Vallone family, Health Commissioner, Veterans Services Commissioner, Mayor's Office of Animal Welfare, and so many other ACC supporters. Opening the first full-service animal shelter in Queens was a major milestone in the city's efforts to upgrade our animal shelter facilities, and it was especially meaningful to be there with the Vallone family, longtime champions of ACC, to honor Paul Vallone. By the end of 2026, the city expects to have a full-service shelter operating in every borough. ACC is a national leader in animal welfare, and I want to thank Ms. Weinstock and ACC staff for their hard work for New York City. This is a mission-driven organization with staff deeply devoted to the welfare of animals and to helping people find and keep their pets. I'll now turn to Introduction 1018, the legislation under consideration today. The department appreciates the intent of this bill as we understand it, which is to align local law with the new state law banning the sale of dogs, cats, and rabbits from pet shops. The council had already prohibited pet shops from selling rabbits as well as guinea pigs and banned the sale of dogs and cats supplied by certain dealers. Many of the changes proposed in the bill will help the department enforce this new state prohibition when it goes into effect later this year, and we support those changes. We would like to work with the council to assess whether some of the bill's provisions, such as those addressing the source of dogs and cats available for sale, are still necessary. Thank you for the opportunity to testify. We're happy to take your questions.
Okay, thank you. I want to acknowledge we've been joined by Council Members Brewer and De La Rosa. Okay, so I have been to the new Paul Vallone Center, and it seems really nice. And what we have to work on now is some of the overcrowding and just in general, based on the testimony that everyone gave, and also a lot of my questions focus on spaying and neutering as well. So let me start by asking question. So this is for DOHMH. What role does DOHMH play in animal welfare in New York City, Commissioner?
So the role of the health department are the issues that I just outlined in my testimony, and I work very closely with Ms. Weinstock in the work that they do at ACNC.
How does DOHMH evaluate the relationship between animal welfare and public health in New York City? What specific health issues related to animals does the department currently monitor, such as zoonotic diseases or pet overpopulation?
It's a big question. I will say that our disease control division has disease detectives, and a lot of their work is monitoring reportable disease, some of which are connected to animals. I noted in my testimony the work that we do to monitor rabies in wildlife and to prevent rabies. We'd be happy to talk to you some more about all of the work that we do at the health department relating to animal and human interaction when it comes to health.
What role does DOHMH play in educating the public about responsible pet ownership, adoption, and resources available for prospecting and current pet owners?
I'm glad you asked that. One of our functions is to educate New Yorkers about responsible pet ownership. I brought my Be a Responsible Dog Owner pamphlet. Would love to get this out to council members so you can help us distribute this. Being a responsible pet owner is key, and we outline in here a number of things that we want New Yorkers who have pets to do, including getting a dog license.
So this is open. I'm not sure which or all of you want to answer this. How does the adoption process work? Because some of the people I've spoken to said it's a cumbersome process, so I want to see if there are ways that we can make it easier for people to adopt.
The process, there's many ways that one can adopt. We have mobile adoption events in different communities, and you can also adopt inside any of the shelters. And we also have people who foster animals who facilitate adoptions. In terms of process, there is an application to fill out just so that our adoption counselors can understand what you're looking for. And we invite people to come into the shelter and take a look and see the animals that we have. You can use our app to identify animals, dogs, cats, rabbits, and guinea pigs. To the extent that it's complicated, where we have a lot of animals and a lot of people are interested, and there's a process where one has to be a little patient with us. The goal is to get as many adopted as possible. Sure. And if there are other specific ways that we can make it even more effective, we're always willing to listen and see if that's feasible.
Is there, maybe there's a way technology-wise or something along those lines that we can discuss and figure out? I appreciate that. Also, what's the process to foster? And if you can go into a little more explanation of what fostering means and what the responsibilities are and how somebody can apply to do that, that'd be great.
Do you mind if I add something on the adoption? I
Sure.
apologize. I just wanted to note, because I assume, I don't know if the question was directed only for ACC, because
No.
I think
Anybody,
Risa's
I said
speaking
anybody can answer the
Yeah,
question.
no, so Risa, of course, is speaking to ACC's policy. I have heard as well that some people have barriers. It's hard to adopt. I wanted to rescue an animal. And each organization that adopts animals out, of course, sets their own policies on how and procedures, so it can really vary depending on which organization and rescue you're working with. Animal sheltering leaders across the country are really promoting what's called open adoption philosophy, encouraging fewer barriers to adoption. So, limiting or not setting up, oh, well, if you don't have a backyard, you can't do that. But it doesn't mean that you don't have any requirements. It's conversation-based. And I know at ACC, the adoption counselors there, that's how they do their process. It's conversation-based. So it's about finding the right fit and not creating more barriers, because ultimately those adopters or those potential adopters are going to get their pets somewhere, and you want to connect them with the adoptable animals and also set up that relationship between rescuer or shelter and adopter so that if there's any follow-up questions. So, sorry, it's a long answer just to say encouraging open adoptions, I think.
Separate from this hearing, maybe we can set up a small task force with some of the rescue groups and talk about how we can make it easier.
Thank you.
Wave your hands. Thank you. Let's see. Sorry. How does DOHMH currently enforce New York City's pet shop laws, and what challenges do you face in ensuring compliance? I presume a lot of them have shut down, the pet shops, but...
So the health department permits pet shops, and we conduct routine annual inspections, and we also inspect in response to complaints. Generally, we see good compliance, but if there are issues where the pet shop is out of compliance, we issue a summons subject to a fine, and we can take other enforcement action as well.
How effective have the regulations been in preventing the sale of animals from puppy mills?
So I think the law that the council enacted was quite effective in preventing the sale of dogs and cats that came from the certain breeders that are set out in that local law. We did a lot of work educating pet shops before the law went into effect. We saw good compliance, though not 100% compliance, and so we did take enforcement action when we saw shops out of compliance.
Because I just want to note, so last year we passed the guinea pig bill to make sure that guinea pigs were not sold in pet shops, and as a result of that, the population has gone down, right, in the shelters, correct? Of the guinea pigs.
That's correct. It was very helpful.
So, I just want to note that it took a while to get that passed, but we were able to do that last year, and it has been quite effective. Can you tell us, like, how much? I think it's quite a big percentage in terms of lowering the numbers of guinea pigs that were coming into the system, correct?
Overall, yeah, I don't have specific data,
that's
but
fine.
yes, the trend that we saw after the passage of that bill, same thing with rabbits, is that the number of rabbits and guinea pigs declined.
So, Commissioner, how do you track compliance with the pet law?
We do our annual inspection, so every pet shop has to have a permit from us, and we will do an annual routine inspection, and then inspections in response to complaints, and that's how we identify whether the shops are in compliance with a host of issues, not only the source and prohibitions that have been set out by the council and the local law, but the health code sets out a range of animal welfare provisions that pet shops have to follow.
Is there a number or some place that people can connect with at DOHMH to report somebody that's out of compliance?
People who observe pet shops out of compliance should call 311, and we take those complaints and follow up.
To your knowledge, does 311 have a separate section or code for that?
Let me see if we can get the answer to that while we're here.
If not,
Let's
that's
see.
something that we might want to legislate.
Yeah.
So now I want to talk about spaying and neutering for a little bit. Local Law 59 of 2011 requires that all free-roaming cats with owners be spayed or neutered to reduce the feral cat population, and requires owners to submit proof of sterilization upon request by DOHMH. Under the law, owners may be fined between $250 and $500 for letting their unsterilized cats roam free. Is DOHMH in full compliance with the requirements of this law?
The health department does enforce that local law. So when we observe a cat that appears to be an outdoor cat, we will ask the owner for information about spay-neuter status for that animal, yes.
How many requests for proof of sterilization has DOHMH filed in the past year?
We don't have that data.
Do you not collect it? Folks,
We collect the information only where we have issued a summons for failing to comply. And in the instances where we have done that enforcement, we have found compliance, and so we do not have the data on having asked for the information.
is there a reason for not doing that, or is there a funding issue, staffing issue?
It has not been part of our protocol to document that in a way that we can pull the data.
All right, but we'll revisit that. What circumstances would trigger a request by DOHMH for proof of sterilization?
So these are typically inspections where we are responding to a complaint, or we're doing a rabies investigation. And so we will be out in the community making observations, and if we do see a cat that appears to be an owned cat that is allowed to roam outdoors, we will ask the owner for that information.
How many notices, let's see if you do this, how many notices of violation has DOHMH issued in the past year?
For this circumstance, you mean? Mm-hmm. So we have, when we have conducted these inspections and made those observations about the cat and asked the owner, we have found that cat to have been altered, and so we have not issued violations.
Okay. So none? Now, come out, folks, please be quiet.
Right, that is right. We have found compliance, and so we have not issued violations.
Okay. Does DOHMH provide access to low-cost spay and neuter services to help ensure that New Yorkers comply with the requirements of Local Law 59?
So the city, through the council's initiative, has a program to offer low-cost spay and neuter services to people who meet income eligibility requirements.
What additional resources are needed to ensure adequate enforcement of the city's spay-neuter requirements?
We're not asking for additional resources.
I didn't ask if you were asking for it. I'm asking what additional resources are needed to ensure enforcement. So you're saying you don't need any?
We don't need any additional resources to enforce.
So I want to ask Ms. Weinstock, tell us the percentage, because I know we had talked about this when we met, the percentage of animals that you get at the shelters that are not spayed or neutered.
Close to 59% of the animals coming in are not spayed or neutered.
I mean,
and it's been going up.
This just shows that, and you know, one of the reasons for having this hearing today is to see what we may need to do legislatively to increase spaying and neutering opportunities for folks. So,
If I could just add to, I'm so sorry.
yes,
May I
please.
jump in?
I'm sorry.
No, it's fine.
And also, I'm sure you're taking notes about this as well, so that we can.
Well, it reminded me that actually one of the projects that my office is working on is a flyer about spay-neuter. A Mayor's Office of Animal Welfare, possibly co-branded flyer, to explain the importance to do outreach, to link to the health department's website that has some links to providers, and then just reiterating what I said in my testimony about this office exploring everything to see how we can increase accessibility.
So one of the things that I had asked, and I presume once all of you have finished the admin has finished testifying, there'll be somebody that stays to listen to the testimony, because there are organizations out there that do this work, and I want to see where we can do a public-private partnership as well, so that we can take best practices and figure out how we can deal with this problem together. Does DOHMH receive complaints of unlawful breeding and housing of animals for sale?
I do, while we're on complaints, I can answer your question about 311. There is a separate complaint function for complaints about pet shops, including that the pet shop has received animals from a improper source.
Okay.
So we would take complaints also about, sorry, can you repeat exactly what you were asking about complaints?
Hold on.
Complaint about animals being sold out of a home, is that what you said?
Yeah.
Yes, we would take complaints about that as well, yes.
Okay. We'll take a look. Do you have those I realize that you saw that they do take the complaints. Do we have those numbers, or you just don't have them right now?
I don't have our complaint numbers, but we can certainly pull those and send them.
If you can pull those and send them, and
Yeah, we will
make
do that.
note of it. You don't see it? Okay. I'm sorry. All right, can the complaints of unlawful breeding and housing of animals for sale, do you know how many, you're going to get back to us about that?
We'll get back to you
All
on
right,
the
fine.
complaint data.
The health code prohibits keeping animals for sale in a dwelling. Has DOHMH enforced this provision? And how does DOHMH receive information about these violations other than 311, and what steps does it take to address them?
We have done enforcement. We learn about it through complaints, typically. These are difficult to enforce, and it is unusual. It is an unusual complaint. I don't have the numbers, but it is not a frequent complaint that we get.
Okay. What enforcement actions has DOHMH taken against pet dealers that do not comply with the current pet shop regulations, and what penalties are in place for continued violations?
So this is for animals from an improper source?
Mm-hmm.
So we have done some enforcement actions for the pet shops that were out of compliance. We will issue violations, and then we can take additional enforcement actions, including ordering the pet shop to cease and desist the unlawful behavior. And when we take these actions, they're complicated in the sense that we prioritize the health and safety of the animals in the shop. So we want to take an enforcement action that also recognizes that there are animals that will need to be cared for in an ongoing way.
What about online postings for animals? How do you do enforcement in that regard?
I'll have to get back to you. I'm not sure that we enforce that or have the capacity, the authority to enforce that. So we'll get back to you about that.
What are the types of facilities that DOHMH permits in terms of selling of pets?
The health department permits pet shops.
I mean, do you give permits to any commercial breeding kennels or persons who deal in pet animals in settings other than a traditional pet shop?
We do not. There are state and federal permitting systems.
Okay. Does DOHMH collect and report data on the impact of the bill on the ban of rabbit and guinea pig sales?
I'm not aware of a reporting requirement. We have enforced those prohibitions. We've seen good compliance.
So how do you enforce compliance? Or the effectiveness, I'm sorry.
How do we assess
How do
the effectiveness?
you monitor the effectiveness in reducing pet overpopulation and improving animal welfare?
So we will conduct inspections, both the routine annual inspections and inspections in response to complaints. If we observe a pet shop selling prohibited animals, such as a guinea pig or a rabbit or a dog or cat from a source that the council has prohibited, we will issue violations, and we can take additional enforcement action if we see ongoing non-compliance.
What are DOHMH's long-term plans for monitoring pet stores after all of this legislation goes into effect? And I presume you made comment that there are routine inspections and audits.
So we've been working for many months, anticipating the new state law that goes into effect the middle of December, to make sure that the pet shops that are still selling dogs and cats, although they are selling them from the sources that are permitted in New York City, but they will not be allowed to sell dogs, cats, at all after December 15th. We've been in touch with all of them on an ongoing basis, helping them to be prepared to cease the activity that will become illegal. We've been communicating with them, and we'll begin enforcement of that as soon as that state law becomes effective.
Okay, so Ms. Weinstein, now I'm going to come and concentrate on the ACC centers. So, what is the current capacity of each ACC shelter, and how often do you exceed this capacity in each shelter? And can you provide a breakdown by borough of shelter capacity?
When we speak about capacity, it's more than just space. It includes staff, and it includes everything that's going on with all of the populations, all of the species. We currently have in care a lot of animals, and certainly we are looking at ways to creatively house all of these animals. The intake far exceeds the physical cage space in any of the care centers, and it's something that it's really difficult to plan for because we do not want to warehouse animals. So it's not about the number of cages, it's more about what is the capacity. In terms of each borough, we're talking about Manhattan, Staten Island, and Queens. And give me a moment.
Do you have those numbers, or?
Well, right now, the entire census of the animals that we are housing, we are at 797 animals.
And do you have the breakdown by borough? I mean, you can get it to
Well,
us.
Queens has over 400.
And that's because of Brooklyn, the Brooklyn shelter closing, right?
Yes.
Okay.
I think it's a combination, however. I would say Queens has never had a full-service care center.
Right.
And
right,
so
right,
I think that we're seeing animals from Brooklyn and a more, just more foot traffic from the borough of Queens.
How many animals have been in ACC's care for over 6 months, and are there any trends you might have noticed that may play a role in why certain animals are harder to adopt?
Animals that have been with us for over 6 months are large dogs. There's not a lot of them, but there's a trend. Some of the dogs just don't get adopted and they stay. So, it's not the main. Our average length of stay right now is about 14 days. So 6 months is a little bit above, is way above the norm. In terms of how to get visibility on them, we do a lot of social media. We invite people to come into the shelter. We ask all of our stakeholders to advocate, to talk about adoption, to direct people to our care centers. I mean, as I testified, there's no shortage of available animals to adopt. And the issues for why they're coming in, it just seems to outpace how many get adopted. And the challenges with dogs that are larger or that are longer stays, I think it's everything I've been testifying to. It's affordability. For the same reasons that they're coming in, I think people are not as, there are not as many people who have the wherewithal to adopt right now.
One of the things that I was impressed with when I visited the Queen Center was that you have a program to try and get people to keep their animals, because especially if they can't afford them or there are issues. Can you talk a little bit about what you do in that regard?
Yes, that's all under the umbrella of our admissions program. It's something that we're really proud of and something for which the Queens Care Center was designed for. So if you notice when you walk in, there are 2 doors. You can go to the left where admissions are directed, or to the right where adoptions are directed. And in the admissions program, it's a really sensitive and painful process for individuals who show up and say, you're my last resort. I don't know what to do. We have private rooms set up so that our admissions counselors can do surrender prevention counseling, which we feel is a very, very important component to what we're seeing in animal welfare right now. And the counseling can be just starting with, what is the issue? And if it's a simple issue that can be corrected, is it food? We have a food pantry. They're not using the litter box. We can help you. We try to provide as many resources as we can to help that family keep their pet. I mean, there's a lot of heartbreak on that side of animal welfare and on that side of the building, and that's why it was created with all those private spaces. And we feel with the public clinic that the clinic as part of the shelter, that is going to be the next step and the arm of our surrender prevention program. If your dog needs a dental, we can do it for you.
About what percentage of people that come in that need to say they want to surrender their pets go away with keeping them? I mean, approximately. I'm not asking for an exact.
Well, in the past, this year, we've been able to keep over 1,000 pets with their families.
That's amazing. So out of how many that come in? Like,
Well, you know, we have a statistic
I mean, like,
of how many were
no, like,
surrendered.
for example, the 60%, 70%, 65% of those who come in that want to surrender their animals, you're able to keep them together with their owners.
I can get data for you,
Okay,
but I'm, you know, consulting with my
Because
colleagues
obviously, I mean,
over here
it seems
about
like it's a
20.
successful program. We just want
Yeah.
the numbers.
We think offhand about 20%, but I can, you know, get you more specific
Okay.
data.
How does ACC manage cases involving exotic pets or animals not commonly kept as domestic companions? And what happens to those animals that come into ACC's care?
Exotic animals is we consider anything other than a companion animal that can be adopted. In many ways, those are the easiest cases to handle because we partner with very specific rescue organizations that take that type of animal. I know that if you took the tour on Tuesday, I know you and I took a tour before that. There is a room that was created, the exotics room. We had a duck in there on Tuesday. So those move pretty quickly. And we're very proud of those partnerships. That's really helpful.
What special care protocols are in place for senior animals, both during their time in the shelter and in efforts to find them adoptive or foster homes?
Senior animals, just like young animals, they're all animals. They're all available for adoption. And that's part of the adoption process and what Alex mentioned about the conversation. Based on your lifestyle, a senior pet could be perfect for you. This is especially when you're talking about a dog, this is a dog that's not going to want to go hiking. If your lifestyle is such that a senior pet would be more suitable, we will direct you to senior pets. You know, they are a little harder to place, I think. I think a lot of people come in with a family and they're looking for that lifelong companion. But we have we don't really base it on age, we really base it on what's the suitable placement with what are your needs for a pet?
Can I piggyback on that? I'm sorry.
No, go ahead.
Just also about adoptions, because it connected with the lowering barriers and open adoptions and why people might be running into problems. I just want to take this opportunity to encourage anyone thinking of getting a pet to just keep an open mind. Like Risa was saying, you know, don't come in with a specific age in mind or restriction. And it's the same with breed or size. You know, they might be running into issues because they're looking for a very specific kind of animal. And if you have a conversation with a counselor who can help you meet the animal that has the right personality, the right lifestyle, the right requirements for you. So I just wanted to throw that in there.
No, and while we're talking about it, I mean, do you guys do any kind of work with the other agencies like Department, you know, for older adults or whatever, that maybe somebody at a senior center is looking for a pet, or, you know, is there any kind of synergy there, or anybody that wants to answer it?
It's not necessarily a partnership, but it's something to explore. when we have off-site adoption events, it's really, those sites are identified by areas that really want pets, where they've been successful. For other centers or other agencies, we've done a lot of tabling events just for awareness, so people understand you could come in and adopt a senior. This might be a good, you know, a good connection. It's more, I think, more awareness than actually having an adoption partnership with certain.
Maybe it's something to look at.
I think there was recently, I don't want to get it wrong, but I think earlier this year, there was an outreach event that we connected, like a senior center and ACC as outreach. Maybe that's what you were.
Because it's possible that, especially at a senior center, somebody doesn't want a young dog because, you know, they're older or whatever. They want a dog that's mature, and so it's just something to think about in terms of trying to see if there's opportunities at some of the agencies to do something like that. How many full-time veterinarians and veterinary technicians does ACC employ, and is the current staff sufficient for the demand?
Based on our population.
You're under oath, go ahead.
Oh. What's that?
I get you. You said you're under oath.
I said you're under oath.
Okay. The current staffing for veterinarians and licensed vet techs is not at the number we want it to be. We have always kept those positions open because they are very, very competitive to hire in those departments. It's really important to note that we could have lots of vets, but if we don't have the vet tech support, that's not a good model. We continue to provide medical services. We use per diem vets to fill the holes. We recently, in the last week, have brought on a medical director who was part of a fellowship with the ASPCA in shelter medicine, and we're really excited for the work that she brings to ACC. And vets, we're always growing that department. We have a lot of animals, and we do a lot of work on these animals, and it takes a lot of time. And I think until we have that perfect number, those positions will always be open.
What strategies does ACC use to recruit and retain volunteers?
We hold regular volunteer orientations. We have a volunteer department with a manager who is charged with creating the program and seeing the program through, determining what level of animal husbandry you not only want to do but are qualified to do. There are also lots of other ways that people can volunteer that don't have to necessarily handle animals. We have it on social media. We post it on our website. We ask all of our stakeholders to share our information about when we have volunteer trainings. We recently did one in Queens in person. There were over 100 people who signed up to volunteer in Queens, and then the process from there is onboarding.
Okay. On average, I'm going back to the spaying and neutering for a minute. On average, how many animals does ACC spay or neuter per month?
Per month.
Want to do it per year? Is that what you have?
Well, I would say, give me a second. On average, per month, we spay 400 animals.
What are your biggest challenges in implementing the city's spay and neuter requirements, and what are some of the things the city can do to help alleviate these issues?
So there are two main challenges. One is the number of animals coming in that need spay and neuter. So we have to keep up with that. And then the second challenge is staffing. You need a lot of people to do spay neuter. It's not just the veterinarian, you need the support staff. So it's resources, and it's trying to address what's coming in.
How involved is ACC in the city's trap neuter return programs for managing the feral cat population, and what are the major challenges and successes of this program?
We do not have, We don't have a robust trap, neuter, return.
Okay.
We do work with community cats, and, but trap, neuter, return is not a major piece of our portfolio.
Like I said, we're gonna, as I said earlier, we're gonna look at some public-private partnerships in terms of trying to figure this out, because I think there's a lot of talent and resources that are available in the city for this kind of stuff. I want to acknowledge that we've been joined by Councilmember Feliz online. I'm going to open it up to some of my other colleagues so that, to give them an opportunity, I may come back to ask questions. I'm going to ask Councilmember Brannan.
Thank you, Chair. How much do we spend every year on spay and neuter? How much does the city spend?
In addition to the resources that we provide to ACC, which spays and neuters animals that it adopts out and provides to animals that go out to rescue groups, the city has a funding for $3 million for 6 years. The current contract that we provide is for 6 years, $3 million, so that would enable us to provide 24,000 surgeries.
So it's $3 million over 6 years?
Correct.
Do you think that's enough?
The program that the council established was to set up the Animal Population Control Fund. The funds are made available through the licensing fees that we generate for people who license an unaltered dog. And our goal is to spend down all of those resources.
And when did you get that money? It's a 6-year contract. When did it start?
The current contract started November 2022.
And how much have you spent down?
I don't have the spending down so far, but I can get that to you.
And what would happen if you ran out of money?
That I don't know.
It's never happened before?
That has not happened before. That would be a great problem. Let me get back to you.
It seems shocking that we wouldn't run out of money, right? If people knew that you offered those services, I'd assume that $3 million would not be anywhere near enough for 6 years.
Well, we're in the first part of the $6 million the $3 million 6-year contract. So we'll see whether we spend that out. But we would welcome, we want people to know about this program. We would welcome your assistance, making sure that people know about it. And then there's the challenges that the providers may face in making sure that they're able to deliver.
Yeah, I mean, we're here to be partners. The issue that, and certainly at, serving as finance chair, our challenge is that you've got to help us help you, because when we're in budget negotiations and we're fighting to get more money for XYZ agency, we're going back and forth with different commissioners, and in private they'll tell us, yeah, we need a lot more money. But then when OMB calls or the mayor calls, you say you're fine. So then we look like, we've got no backup. So we want to help, but we need to be on the same page when we're in budget negotiations, because then if we're saying, look, Health Department, ACC need more money for these services, and then they say, well, yeah, but we talked to DOH and they said they're good. I understand no one wants to look like, they're not able to do their job, but it's not helpful when we're not on the same page there. I want to talk about interagency collaboration. I mean, part of the reason why we wrote and passed the bill to start the Mayor's Office of Animal Welfare was because what we were seeing was, when an animal got loose from a slaughterhouse, suddenly you had 10 different agencies going like this, trying to figure out who was in charge of what. That was really one of the first what got me thinking about starting a mayor's office of animal welfare. So, it touches so many different agencies, and what the Department of Transportation thinks about animals, God only knows. Have you seen better interagency coordination now that you've got the mayor's office of animal welfare?
Thank you for that. Thank you, and thank you again for just. I think it's important to highlight that again. Animal welfare does not exist in its own bubble as its own entity. It's going to overlap, as you recognize, with the work that all these agencies are doing that are typically focused on human beings. I'm not sure that I'm the best person to compare it, in terms of has it gotten better. I can certainly tell you that I think it's wonderful that we have such an office that can help with the coordination. And I am frequently in touch with a variety of agencies, some of whom, everyone here would expect. The health department I'm frequently in touch with. The parks department, they deal with wildlife. NYPD about animal cruelty. But then, as you mentioned, DOT. I am sometimes emailing them about animal issues, or DCWP, or of course NYCHA, DSS, all these agencies that wouldn't, if you're not in the animal world, wouldn't necessarily come to mind as partners. So I do think that having an office, mayoral office of animal welfare is very helpful for that. And to bring all the players together, to get everybody brainstorming, to try to hone down on some of the really challenging issues when there may not seem like there's a clear answer, and we can move forward on that. So.
I guess the question is for Ms. Weinstock. Just largely, do you agree with what the council is saying and what the advocates are saying, that, the stat you mentioned, I think it was you, about how nearly 60% of animals that are surrendered to AC&C are not spayed or neutered? Do you agree that we've got a serious upstream problem here, that where everyone's freaking out because the shelters are crowded, and at times we had to suspend surrenders and abandonments because there was no room? I think our shelters are going to continue to be packed until we figure out what we're doing to subsidize affordable veterinary care and really grow that outreach for TNR services. Do you agree with that?
I agree. There are a multitude of reasons why we're packed, and I also believe that the data, 60% of our animals that aren't spayed or neutered, if that changed, and it's going up, if that changed, I think that it would be a little bit of a pressure relief on the care center, because we are in the position of being required by law to alter every animal before it's placed with the rescue partner or sent out for adoption.
Are there so what are some of the other issues? If that's not the top issue, what would you say are some of the other reasons why the shelters are so crowded?
Affordability. I think, as I've testified, what we're seeing as the top reasons are financial, and financial is really a big number. A lot of times, financial situations we can help. It's food. They have trouble paying the rent, the lights, the electricity. We can give you a free, access to free food, and in return, what we do is we microchip and we license your pet, and we also give you information about wellness clinics. The clinic that we have coming down the pike, I think, will also help tremendously, because people, again, it's an affordability issue. People are surrendering because the cost of care is so high. So if we can help you out through some type of medical service in our clinic, that's what we're going to do. Financial is a really big issue, and then also housing falls under that umbrella. There are a lot of restrictions, especially for lower income housing. The pet deposit, the restrictions on size. There was a really good article in the New York Times recently about the disparity in housing and rentals and apartments in New York City, where if you are, the restrictions on low-income housing are much greater in terms of pets and pets in the home than it is on other income levels. And we are seeing that. We are really a social service agency at this point. We are helping people try to survive. And part of that survival in this city is keeping your pet, because everyone saw through the pandemic the emotional tug and the value that pets offer. And when a family comes in or a person comes in and says, I can't handle this anymore, we've failed that person. And so we have set our services up so that it's not all about adoption. We would love to adopt every single animal out, but that's not the strategy. The strategy has to be managing what is coming in. And by offering these resources, I think we could start to chisel away a bit, but I think it really takes a lot of community collaboration and collaboration with council and the city.
Okay, just a few more I want to give back to the chair. Just even anecdotally, how many times does someone surrender a pet to ACC and say it's because due to housing? They have to move, they can't afford where they're going, and the new place doesn't allow pets.
It's one of the top reasons for surrender.
Okay. And for the cruelty, could you explain a little bit? I don't know if this was for Alex or maybe DOH, but for the animal cruelty and law enforcement. So I know they disbanded that original NYPD unit, right? That used to go out, the one they had the TV show about. It's a great show.
So this year we actually marked the 10th anniversary of the partnership between NYPD and the ASPCA.
Right.
So previous to the current structure, the ASPCA was responsible for the entire city humane law enforcement. And now we have the entire police department of New York City that can and is responsible for enforcing animal cruelty.
Right.
But they partner, and I don't know if the ASPCA is going to speak to this today, but they partner with their experts. So animal cruelty victims will be taken, that are in part of cases, will be taken to the ASPCA, where they have a veterinary forensics team that will work with them. So it's a very close partnership between the ASPCA and NYPD, but we have the entire NYPD. And then as part of this partnership, what was created was the Animal Cruelty Investigation Squad, which is a unit under the Detectives Bureau focused on animal cruelty. That's an advancement. You know, we just have more resources at our disposal now.
And how does your office collaborate with them?
How does my office what? I'm sorry?
Collaborate with them.
Oh, so, you know, ideally we need to get the word out that if anyone is concerned about animal abuse or neglect, to report it to 311 or 911 if it's in progress. So the Office of Animal Welfare is not meant to be the place where you go because we have a system in place, but what the office can do is certainly follow up. If something seems like it's not working, if you're not getting the attention, I always ask people, you know, send me the 311 service request number, I can follow up. And I'm frequently in touch with the Animal Cruelty Investigation Squad at NYPD, asking them questions, seeing if we need to look into something. On that. But you know, the office does not have enforcement powers itself.
Last thing for me for now, have you seen progress or have you seen success in prosecution and seeing that through?
Ooh, that is a good question. The number of cases are posted. There's an NYPD website that has it. I don't have it off the top of my head. I can look into it. And then I don't recall if that's where prosecutions are. I'd have to get back to you on that. But I think there have certainly been more cases. I'm pretty sure I'm correct in saying there have been a lot more cases that have been able to be brought because of this partnership.
I worked on a bill when I was a staffer under Councilman Gentili for the Animal Abuse Registry.
Yep.
So I'd love to get an update on that.
That is, yeah. So my understanding of that is any organization that adopts out animals has to check the Animal Abuse Registry. So it's not that it's open to everybody. Everybody just can't see the private details of someone, but an organization, as part of their process, would make sure that if they're not on that.
And is there a reporting mechanism there? Like, do they say, you know, this month we had 3 people who are on the registry try to adopt a pet, you know?
You mean for every organization that adopts to report to a central
Yeah.
location?
Like, how do we know if it's
I'm not
working?
aware of that. I would have to look into it.
Yeah, I guess the only way we would know if it was working is if we knew we were stopping people, right?
Yes. Yeah. I don't know how many people are trying to adopt after it. And I believe it's 5 years they can not adopt. So someone who was convicted, several years ago could eventually be off, I believe, off the abuse registry.
Okay.
But I'm happy to look into that further and discuss more.
Cool. Chair, thank you.
Thank you. Now I'm going to give it over to Councilmember Marmorato to ask some questions.
Thank you, Chair Schulman. Thank you. This is amazing to see how many people showed up today. I'm really impressed by this. I think this is one of the bigger committee meetings that I've gone to. So I do want to kind of shift gears a little bit here and go a little bit off topic, but still concerning our pets. And I want to discuss mosquito spraying and our pets. And Commissioner Schiff, I know that your organization is in charge with spraying within the 5 boroughs. And I hope that you can answer some questions for me today. And if you can't get the answers for me today, that you can email them over to my office. So one adulticide used for spraying is called Anvil 10+10, and it's relatively non-toxic after a short inhalation. It's moderately toxic after short-term skin contact, but with high concentration exposures, it's harmful to humans and pets. An active ingredient in Anvil 10+10 is diphenhydramine, and this ingredient does not mix with water, which is good, but it does bond to the soil. So my concern is, are there any concerns for animals and pets that touch and eat off of this soil that has been sprayed?
So what I can say now and what I think we should do is set up a separate meeting so we can talk to you about our West Nile virus prevention program, which is why we conduct mosquito spraying. I will say that we use very, very low amounts, a teaspoon for an area the size of a football field. And so we share the environmental concerns that are implicit in your question. But I don't have that information with me for this hearing, but it's a really important public health program. West Nile virus can be an extremely dangerous illness, and we're very proud of this work. So what I'd like to do is get back to you and even set up a time that we can talk you through what we do in this program and how we work. And we monitor mosquitoes around the city, measuring mosquito infectivity, so that we're only spraying when we see high levels of West Nile virus infectivity in mosquitoes, and drawing boundaries of where we're spraying, where we think that people are at most risk of West Nile virus.
Yeah, I know. I've been in contact with your office, and unfortunately, they have not given me a list of ingredients within. We've been doing our own research on this, and it's been a little frustrating not to have emails returned. And just being that we're talking about pets, I know we do have a big stray colony within my district, and I was just really concerned how that was going to interact with the cats. And
So let's set up a time.
okay, I would like that. All right, thank you, Chair.
Thank you very much. Councilmember Ariola?
Thank you, Chair. So I'd like to get back to the 311, where you said that we can report animal abuse. That's incorrect. It kicks you immediately to 911.
I'm sorry. Are you looking at? It says. I think it says if it's in progress. Am I correct?
This is when I put in for 311. There's nothing on the landing page, and then I queried animal abuse, and it kicks to 911. So what can we do? What is the number for a hotline to call for any rescuer, any person that sees or is being called about animal abuse at the time, so that your offices can come out?
So the question that I was, the question that I heard about 311 was about complaints about pet shops. So that's what my colleagues checked about 311 availability to report a concern about a pet shop, including that the pet shop was offering an animal from a prohibited source. As for animal abuse, we can check.
Yeah, I'm not sure if we're looking at the same page. So when you go to 311 and you put in animal abuse, it says call 911 to report animal abuse in progress. And then it goes on to say you can report neglect or abuse of any animal in the city. It continues, and it lets you file, report the neglect or abuse of an animal. And if you click on that, and it's the same if you call 311, it gives you a form where you can then fill out the problem details. So for example, here it lists a variety: chained, in car, neglected, no shelter, other, torture, and you can describe it and you can submit. So it's an online form, but if you call 311, what should happen is, I believe, it connects you to the precinct that is in the address. But the idea is 911 is if someone is actively,
Right, but which is kicked to 911. And you know what happens with 311? And everyone here can attest to it, they close it out.
And that's where you can follow up with my office.
It's closed out.
Yeah, and that's where I can get followed up with.
Right.
Yeah.
So what I want to talk about is because we talked about budget before, Councilmember Brannan brought it up and you didn't have a clear answer. So for the mayor's office, what is your budget and operating, what is your operating budget and what is your staffing level?
So the mayor's office, as mentioned, it's the first in the country and it's relatively new. It's about four or 5 years old, almost 5, not quite. The staffing, it's small. It's one person solely issued on animal issues, myself, but we are housed within, and we have the support, the way it's set up, of the mayor's community affairs unit. So as people may know, there's borough directors, there's liaisons that have very deep connections with community members and community organizations. So I lean on quite a few of my colleagues in that. I sit amongst them within the community affairs unit. Of course, we could always do more with more resources.
Okay, and then, may I? Okay. I want to ask the same question for DOHMH. For these problems, what is your staffing and your operating budget?
I take the question, these problems, to mean all of the work that we do regarding animals. Yes? So I'm going to get back to you about that budget.
Okay. Ma'am, your staffing and budget.
Our staffing as it regards cruelty?
As regard to animals, let's say a rescuer calls, or I call, or anyone gives a call. What do you have in resources available to help all the rescuers in this room, the animals who need the help, and the people who are trying to help them?
When we receive calls identifying an animal in distress or cruelty.
No, I need to know what the number is. How many staff and how much money? Because according to Councilmember Brannan, when they ask at the finance hearings, you guys don't ask for extra money. Why?
How many, is the question, how many staff does ACC currently have?
How
Yes.
many ACC staff do you have, and what is your current operating budget?
We currently have 315 staff, and our contract with the Department of Health is $33.5 million.
$33.5 million. How much of that money goes to administrative costs?
A very small percentage of that.
I'd like to know the percentage.
I don't have that available with me.
We need to know that.
Okay, it's broken
Because you have
down.
$33.5 million to work with, and the rescuers in this room are putting money out of their pocket to save animals on a daily basis.
Come on.
I understand that it is a very large number, and I am very grateful to the city and the administration for that very large number. I think that it's very important to look at the budget and the context of the budget. There are facilities and leases, there's other things that have nothing to do with the personnel and the actual day-to-day operation of ACC. So it seems much larger, but
Well, it's all part
will
of
tell
your
you that
operating
it's not
budget.
$34 million that is going to every animal or the person to care for that animal. It sounds out of context. It's
No,
not
I
out of
understand.
context without
I
better
understand that
understanding.
there's a
That's-
lot included, but what I'm not hearing from any one of you is really how you're helping the rescuers, how you're helping the cats, the dogs, and we're going to get into that. Okay, so all three agencies are saying that you have a wonderful relationship with other agencies like law enforcement, FDNY, DSNY, New York City Parks. I have an issue in my district right now where exotic animals, not ducks, exotic animals are being tortured and being abandoned. When ACC was called by law enforcement on various levels of government, they were told, we don't get involved unless the animal is dangerous. Do you find that statement to be true?
I do not know the context of what you are referring to.
So the abandoned animals there are large pigs, some goats, and they're being slaughtered.
Could we follow up on, I would love to have a meeting with you on that and hear more about it and understand what's going on.
Well, we're already addressing it with many of the people in this room because they're out there doing the work that your agencies should be doing.
We'll follow up with your office.
Okay, that would be great. When you say you have a relationship with rescuers, especially in the NYCHA housing, how do you make that contract? How do you contract with that rescue service? And I'd like to know who it is.
I think I mentioned that. I'm sorry, let me find my notes. Yeah, so I mentioned that, well, there's two different things. One is the Office of Animal Welfare is frequently contacted by and in touch with individual rescuers and rescue organizations and trying to collaborate with them and agencies. So, for example, sometimes there have been rescuers who have been working in part of the city where they need access to a city-controlled site, right? So I'll work with the agency to try to figure out, can we get access? What's needed to resolve this? So there's that kind of coordination. With NYCHA, it's different. NYCHA on its own, and I don't want to speak for them, so we'll have to get back and follow up with any specific questions, but they have a contract that it went through NYCHA, not through the Office of Animal Welfare, to contract with well-known animal rescue organization to do TNR. Okay. And I think that's actually, you know, as we talk about support for rescuers, I think that's a very promising model. So I'm happy to speak further, you know, we can with NYCHA with you and figure something out.
Right. You also mentioned with ACC that you don't really do a lot of trap, neuter, and release, right? But the people in this room do. And they oftentimes have a problem because they cannot afford. So you say that you provide, especially at the one in Queens, affordable neutering and spaying. What is considered affordable? And how do they qualify? You said it depends on income. When you're talking about rescuers that are coming in, so that's me if I have a pet and I want to have the pet neutered or spayed, and then you look at my income and then I'm charged accordingly. What about the rescue organizations? The rescue organizations that are working on a bare minimum, how would that be treated?
The rescue organizations that we work with who pull animals from ACC are getting spay and neuter and vaccines and medical exams. The rescuers that need the help in terms of trap, neuter, return, ACC doesn't have the, it's not in our contract to trap cats and to then put them back in the community. We do work with community rescue groups. We have a community cat program that is similar in that they have the ownership of those cats, and we have actually done spay neuter on a limited basis, not to the extent of a robust TNR program, but that is not part of our funding with the City of New York.
The funding that you're going to get back to us on how much is spent on that kind of activity, right? Okay, I'm gonna wrap up. So we recently, a year ago, opened up a base camp. This is for DOHMH, or a base camp over at Floyd Bennett Field, and many animals were displaced at that point. What type of input did you have when that base camp went up? And were there any animals that were rescued because of the building of that base camp?
I'll have to get back to you about that.
Okay. So I'm just going to close by saying that what I'm hearing here is that there is a complete abandonment of your duties, and you need to really understand that these rescuers need your help, and they need you to do more for them. You need to really stick to your mission statement. I work very closely with a number of them. I'm not contracted with them. They're not contracted with anyone. These are good people who go out and help. And when I call ACC, ASPCA, DOHMH, and I get pushback, they are these rescuers that come, and they just did recently and they helped with the issue with the exotic animals. So do your job better. Thank you.
So, folks, come on. I just want to acknowledge that we've been joined by Councilmember Menon, and before I give it over to the next council member, I want to just say that that's part of what Councilmember Ariola was talking about, was what I was talking about earlier, too, in terms of private-public partnerships, where we have to really all work together on this to make sure that our animals are kept safe and that we do what we can for them. Now I'm going to give it over to Councilmember Holden, and I just want to say, for the other council members that are speaking, we want to give the public an opportunity to testify, so if you can please keep it a little bit brief, that would be appreciated. Thank you.
Thank you, Chair. We're sitting here, and, Councilmember Ariola's questions were right on, and her comments, but there's a frustration out there. There's a frustration that when we call for animal abuse, that we get the precinct showing up. We get the precinct officers showing up. Now, they're holding 5 911 jobs. Are they going to treat a complaint about animal cruelty seriously? And the answer is no. My experience in the 7 years in the council, there's a huge hole right here that we're not filling. And it's up to the local groups that we fund a little bit. We give them a small piece of our funding, obviously, but it's not resonating, it's not working, and the city, and especially the health department, is asleep at the wheel. This is the truth. In my 7 years, I've really, you go to the health department, the fact that you can't, Deputy Commissioner, the fact that you can't tell me or tell us how many people are working in your office for animal welfare. You can't come up with that number. You should know that. You're coming to a hearing about this. So I'm frustrated. We're not doing enough. And given the pandemic, coming out of the pandemic, ACC was overwhelmed because a lot of people, very few adoptions, we couldn't even contact one another, and they were left holding the bag. And where was the health department? I'm appalled at how the city brags that we're doing a lot, we've done more for that animal welfare. That might be true from the past administrations, but we're woefully, and that's a disinvestment over decades in the city for animals. Just look at, let me ask the health department, have you gone into the live markets and inspect those? Is that under your jurisdiction?
Those are under state jurisdiction.
Yeah, but not yours.
Correct.
Okay. And do you contact with the state about this when you get a complaint? When somebody calls 311 about that, the live markets, do you work with the state?
We will refer those issues to the state.
And what about the horse carriage industry? Do you go into the stables and inspect those regularly, or answer complaints on horses that seem lame and and seem to be laboring in the heat or the cold or inclement weather? Do you go into the stables, or do you inspect the locations around Central Park?
We do.
You do. And on a regular basis, how often do you go into the stables?
We're in the stables regularly. I'll get back to you about the frequency of those stable inspections.
So you don't know the number. So again, this is consistent with the health department. This is what I've witnessed. And the mayor's office has one person in the animal welfare, unfortunately. We talked a few years ago, and it still hasn't gone up, unfortunately. The problem I have with some of your comments about the animal cruelty, NYPD, I don't even know if they're functioning, really. I really don't think so. Because every time we've complained, we get an answer like, especially about the horses, we get, oh, well, the vet for the industry said that rider, the horse that collapsed, was okay.
Yeah, and in all cases, please follow up with me if there's a specific, just like that, or anything else that comes up. I think There are trainings that go on for NYPD officers. There's ASPCA trainings. There's ACES, Animal Cruelty Investigation Squad trainings. I do have some ideas of ways the Office of Animal Welfare can hopefully work with NYPD to try to, just raise awareness about the issues. But again, just follow up, if you can always follow up and see.
But it seems to me that ACC has a contract, and they, it's a fixed amount. But there's no like coming out of the pandemic, we knew that more people are surrendering their animals to ACC. That's a given. And I've spoken to President Weinstock on this, and I visited the shelters, and I've seen what they're up against. I mean, they're on the same team as everyone out there. We're trying to help our pets and animals. But I just don't feel that there's enough support, and there was no thinking, nobody sat down apparently and let's say we got to adjust the budget on this for spay and neutering, because that'll help on the back end in the shelters. Once we do an aggressive spay and neutering, and the chair mentioned this, then we wouldn't have overcrowded shelters. So that's the investment that needs to be made, but it's the advocates that are left holding the bag. And it's sad, and it keeps going on. Nothing changes. I've been doing this 7 years, like I said, and even before I have a lot of groups in my district that they give their entire basements over to rescues, and they have to now find spay and neutering or fund it, by raising money. But the city doesn't really help.
And again, this is an issue that my office is very interested in.
So it's a problem, but what is the mayor doing about it?
So I think I mentioned in my testimony, I can try to go back to that, but we're constantly meeting with all the people you met, not all the people, but a lot of the rescuers, the individual groups, where we were trying to see how we can, if there's anything we can do on the vet shortage and veterinary tech shortage, if there's anything we can do, I think, like the chair said, to bring the players together. I think a lot of it is coordination, public-private partnership, having a lot of those conversations, trying to figure that out. And I would love to have follow-up meetings to get into the details of how we.
Yeah, the problem is that the Department of Health is not. It's not an issue with them. It's not a serious issue. They contract with ACC, and then they just turn their backs.
Councilmember,
that's what I.
Councilmember, we need to move on. So if you have a specific question, ask it. There's other people want to testify, and I have other council members that ain't asked.
It's amazing. I always get cut off. It's amazing. It's like, did you see anybody else get cut off here? Thank you, Chair. Thank you.
Councilmember Brewer.
Thank you. First, I have a question from Councilmember Susan Zwang, who had to leave, and she said, I have 2 kids who love animals. This is for ACC. I have 2 kids who love animals, and they want pets. Does ACC have any programs with the school or the Department of Education that teach children how to take care of pets in the school, as classroom pets, or at home? That was her question from Councilmember Zwang.
We do have a community kids program, and it is really our goal to educate the next generation of pet owners and also to bring kids into our care centers. Queens was set up so that we can have kids there doing things that are related to animal welfare, like planting food for our rabbits. So if I will just reach out afterwards and connect her with our community.
I think you should do that. She would appreciate that. I have a few questions. First of all, just so you know, we have your mobile unit at our district office at 87th Street in Columbus tomorrow at 12 noon, and we appreciate that. Second, we just wrote a letter to all the veterinary services on the Upper West Side stating, because this is the barrier, can you lower the cost? This is even just trying to get the private sector to be supportive. Anybody who wants our letter, we can send it to you. But so many people have called about that issue. So let's see if any of them are able to do that. Third, we have a meeting in November, because every month we have housing lawyers, and this is going to be in pets, housing and pets, which is a huge issue for our city. What we're hearing today, though, is just, I think, a lot of these numbers, and that's what the cost is. You heard, I think the bottom line is the city needs to allocate more funding for animals in our city. Given the cost of sheltering an animal, I don't know how much it is. Why don't we, how much is it per month is what I'd like to know. Does it make sense to increase funding? This is for the Department of Health. For surrender protection, efforts that cost a fraction of that per animal. So how much is it per month, and what is the amount that we could be or should be using for surrender prevention? This is for health department. How much per month is it at ACC to shelter?
The cost of surrender prevention, it really ranges. It could be something so simple as a food pantry, which could make, what would that be, $100 a month?
Okay.
Or a harness, or, you know, a litter box. So it could be something very small.
Or it could be
Or it
something.
could be something like dentistry could cost $1,000. Someone just told me they took their pet for some basic care to a vet. It was over $600. So it really runs the gamut depending on what the issue is. But I think that we could solve a lot, and we have been solving a lot with very lower end, just a lot of people who just need food right now.
But how much does it cost without any of this just to have the animal in your shelter per month? Just what does it cost? Not
The cost of care to
Yes,
have an
per month,
animal
yeah.
per month?
It depends on species.
Yeah, I have to get back to you. That's like dogs, cats are a little different, but there, I can give you a number.
The reason I'm asking is obviously the comparison, right? If it costs, I'm making this up, $1,000 a month, I have no idea, and it's costing much less to work on much more funding for surrender protection, then we should be looking at the latter. That's what I'm saying.
Absolutely.
Okay.
Right.
What does Health Department allocate? I think you heard a little bit of this from Councilmember Justin Brannan. What does the Health Department allocate to ACC in the last budget? I think we heard this $38 million. And the question is that adequate? In other words, I need that Department of Health to state whether or not whatever ACC gets is adequate. Now, I know OMB says don't talk, don't say, don't do nothing. I got it. But can you be a little bit more honest? Because there's obviously not enough funding going to this effort.
So the city's budget is just under $34 million for ACC, and it does include, and perhaps Ms. Weinstock, when she provides some of those more detailed budget information, the funding from the city does include many of the surrender prevention activities that ACC does. And
It does or does not?
It does. And ACC also does additional private fundraising. And the Surrender Prevention Clinic, which I think is going to be an incredible innovation for ACC and very helpful for people in improving their ability to keep their pets, is funded by the city. You know, I'll channel my commissioner, who will always say at the budget hearings that he would never turn down additional funding, but we're not here to ask for money. That no commissioner, I think he says, no commissioner would ever turn down an offer, but we're not here to ask for resources.
So the other question is, how do we end up with this model of, you know, the private sector basically having to do all of this work? Is that something that you are working on extensively to think about? That would cost more money to have you do some of the work that the private sector is doing. Well, how do you look at that? Does that come up in discussions? Is there some policy change needed, et cetera? How do you answer that?
So we have been implementing the local law, which is the Animal Population Control Fund, that sets aside city funding for low-cost spay neuter for people who meet eligibility requirements. We'd be happy to talk to you about ways to expand the Animal Population Control Fund.
Okay, finally, I know you're going to meet with this chair, who's fabulous, about some of these barriers. Cost is a barrier. That barrier has to be addressed in terms of the spay neuter, et cetera. What are quickly some of the other barriers that you see that end up with so many individual animals in the shelters? What are some of the other barriers? Alex, go ahead.
Housing.
Housing. Okay, in other words, people have the housing that is not appropriate, or they don't have housing to be able to have their animals. Is that what you're saying?
Yes.
Okay, anything else? Cost, housing? Come on, there must be others.
I think those are interrelated a lot. Finances can be losing a job, can be having to find a more expensive, not finding affordable housing. I know when ACC does intake reasons, it's sometimes hard to select just one or two because, again, they overlap so much. You almost have to choose, like, what's the primary one? You know, if someone loses their job and they have to move somewhere again, it could be 3 different reasons. It's a cost of care for a pet, it's lost job, it's moving. I'm not sure what the current categories are.
Okay, so those are not things we can necessarily address, but we can address the cost, for sure. I was trying to look at barriers that are the city's responsibility, which would be different than an individual's responsibility.
Housing is a big one.
All right, but in other words, maybe as an example, you need some kind of care while you're moving. That's something that would be an example of able to deal with. Obviously, the care is expensive also, but that would be an example to me. Those of us, I know my sister, always traveling, puts the dog in some kind of care while she is traveling. Example. Finally, at Department of Health, how many people focus on this issue? Not at ACC, but at Department of Health. How many people actually focus on this issue? In addition to you.
Right. Well, what I can tell you is I can't give you the agency-wide number because there are people beyond my my division and my program that focus on this, but our Office of Veterinary Public Health Services is 18. But there are other people around the department. So that
18 people.
18. That would be the minimum number. But we have other people around the agency who work on animal issues.
Okay. I just want to say also, my office in the district is right next to the Wild Bird Fund.
Yes.
And we love them. Thank you very much, Madam Chair.
Okay, Councilmember, thank you. I have a couple of questions to ask before we close out. So I just want to get back to the wet market for a second. My understanding from our council is that there are health code provisions under DOHMH to enforce that specifically address the live market. So it's not just totally the state. The city's Department of Health has some responsibility there. So, okay. Isn't this an environmental sanitation issue that DOHMH is responsible for?
You know, it could depend on the particular issue. So the health department would address nuisance conditions perhaps in the area. The sanitation department could address issues out in the area, but the regulation of those markets is under the state. If
you would be kind enough to send us specifically what it is that DOHMH is responsible for under that, that would be very helpful. I want to thank the panel, but I also just want to say that, and I also want to say that I want to make a comment that ACC does the best that it can. I want to say that, which has been told to me by a number of the organizations that are here today, but I also want to say that I am disappointed that DOHMH didn't seem to be as prepared as I would have liked. And so we need to get answers to a number of questions, and I also want DOHMH to really take seriously the issue of animal control. I think it's sort of a side issue as opposed to an upfront issue, and so, but I want to thank everybody for testifying today. We're going to take a 5-minute break and then do the public testimony. Thank you.
Hi, it's Gail Shula. Hi. Just in terms of Carl, I don't know what to do. Even today, when I know I sent him that the school thing was postponed. You saw it. Okay, but I did see it. So my question to you, I don't know. Okay, so please make sure he puts it on the other date that's there. Sorry.
May I have your attention, please? Shh. Keep it down, keep it down. Keep it down, please. Shh. Thank you. Can everyone please have a seat? Again, can everyone please have a seat? Thank you. Shh. Again, keep it on, please. Keep it on. Shh. Quiet in the chambers. Thank you.
Okay, we're going to get back into session. Thank you. We're going to do public testimony. I now open the hearing for public testimony. I want to remind members of the public that this is a government proceeding and that decorum shall be observed at all times, and you've been pretty good, so I have to thank you for that. As such, members of the public shall remain silent at all times. The witness table is reserved for people who wish to testify. No video recording or photography is allowed from the witness table. Further, members of the public may not present audio or video recordings as testimony, but may submit transcripts of such recordings to the Sergeant at Arms for inclusion in the hearing record. If you wish to speak at today's hearing, please fill out an appearance card with the Sergeant at Arms and wait to be recognized. When recognized, you will have 2 minutes to speak on today's oversight topic, the state of animal rescue in New York City. I also want to let folks know we're trying to keep to the 2 minutes because we have over 150 people that want to testify. I want to make sure we get to everybody. We're going to be here for the long haul. If your testimony is over 2 minutes, I'm going to ask you to submit it. We will read everything. It will go into the record. So you can just give a summary, and that would be great. And I want to thank everybody for being here today because this is such an important topic, and there's a lot of stuff we're going to follow up on, and I appreciate it. So if you have a written statement or additional written testimony you wish to submit for the record, please provide a copy of that testimony to the Sergeant at Arms. You may also email written testimony to testimony@council.nyc.gov within 72 hours of this hearing. Audio and video recordings will not be accepted. And now I'm going to call the first panel, Michelle Villagomez. Sorry if I butcher a name or something. Matt Goldweber. Rena LaFelle. Lucy Jayton. And Dolores DeFari. And these are all members of the ASPCA. Who's going first? Okay. You may proceed.
Good morning, Chairperson Schulman and members of the Health Committee. My name is Michelle Villagomez, and I'm Senior Director for Government Relations for the ASPCA. Shelters across the country are full, with over 6.5 million dogs and cats entering shelters last year, but only 4.8 million of them finding homes. Many shelters, including AC&C, are facing placement challenges due to animals with longer stays, often because of complex medical or behavioral needs, ongoing staffing shortages, and insufficient adoption rates. One of the most effective ways to reduce shelter overcrowding is through the implementation of comprehensive surrender prevention programs. They should include not only affordable veterinary services, but also support for pet owners facing housing instability, domestic violence, or homelessness. Pet-friendly housing is a crucial component of this holistic approach. The city should work with developers, landlords, and housing authorities to increase the availability of pet-friendly apartments, particularly in affordable housing complexes. Housing laws and policies that ban pets, prohibit specific breeds, require cats to be declawed or dogs to be debarked, or severely restrict pet ownership based on size should be rejected. Additionally, policies that protect tenants with pets from unfair eviction or discriminatory practices must be strengthened. We need to expand the availability of pet-friendly shelters for domestic violence victims and the homeless. By ensuring that shelters can accommodate pets, we can provide a lifeline to those in crisis while alleviating pressure on our animal shelters. Today, you will hear from my colleagues in community medicine, community engagement, and adoptions, who will provide further insights into the specific programs and services the ASPCA offers to AC&C, pet owners, and rescue organizations. Our efforts are designed to complement and bolster the essential work that ACC does every day. But it is important to note that ACC needs more resources and continued support from the city and the public to better meet the needs of New York City's animals. The need for affordable veterinary care, shelter resources, and comprehensive animal support far exceeds what any single organization can deliver. We commend the committee for considering a multifaceted approach, and we stand to work with the council to make it a reality. I just want to
You can summarize.
Oh, thank you. My team here is going to talk about what resources already exist, but the takeaway is it's not enough. And we're here to say you can't just rely on the rescues and on the nonprofit partners to do it, but there are some resources available, and my colleagues will speak to it.
Thank you. Next.
Hello, my name is Dolores DeFerrari, and I'm the Senior Director of Operations for the ASPCA's Community Medicine Program. New York City is home to countless animal rescue organizations that tirelessly work to save the lives of pets and place them in loving homes. These organizations, often staffed by dedicated volunteers, are on the front lines addressing the needs of abandoned, neglected, and homeless animals. The work they do is not only vital for the animals they save, but also for the broader community. One of our top priorities is to make veterinary care more accessible to underserved pet owners. Next week, we will cut the ribbon on our new community veterinary clinic in Long Island City, Queens. The Queens Clinic will perform an estimated 11,000 surgeries annually and provide 10,000 animals with primary pet care services. It will join the Bronx and Brooklyn clinics, which opened during the pandemic and have already made a significant impact, caring for over 140,000 cats and dogs across New York City since 2020. In this time frame, we've provided ACC over 10,000 free surgeries, rescues with over 71,000 free surgeries, and owned pets with over 6,000 surgeries. While these numbers are significant, they only scratch the surface of the need. The demand for appointments at our clinics is overwhelming, with schedules often booking within minutes of opening. Our strategy and research team estimates that an annual spay-neuter need for lower-income households, which is below 2 times the poverty level, is 85,000 surgeries for dogs and cats, excluding community cats, which would be at 193,000 animals. We have been deeply affected by staffing difficulties due to the national shortage of veterinarians and veterinary techs. The need far outweighs the supply, not just in terms of facilities and funding, but also in terms of qualified veterinary professionals. Vets must be highly skilled to perform high-volume, high-quality spay and neuter surgeries. We are committed to doing all that we can to support the animals and people of New York, but we can't do it alone. The need for affordable veterinary care cannot be met solely through the efforts of nonprofit organizations, no matter how dedicated or expansive their operations. We urge the city to continue to consider implementing programs and policies that increase the availability of low-cost veterinary services.
Thank you. Next.
I'm Matt Goldweber, Senior Program Manager for the ASPCA's Community Engagement Team. Surrender prevention programs are of critical importance to keeping pets and people together. This work includes low-cost veterinary services, pet food assistance, and behavioral support, and helps pet owners address the challenges that might otherwise lead to surrender. By investing in these programs, the city can proactively prevent the influx of animals into shelters, ultimately saving resources and lives. Our team works with pet owners and local agencies to identify solutions to keep animals in their homes when possible. The team is comprised of 11 animal welfare professionals and handles nearly 400 cases per year. In 2023, we assisted nearly 2,000 pets. We provide access to low-cost veterinary care, spay-neuter services, and additional resources such as pet food and supplies and proper pet housing. Our program is a one-time voluntary service intended to provide relief to pets and owners facing hardship and educate them on pet ownership. We cannot compel people to accept our services, and any assistance is provided at their request and/or our recommendation. For any pet needs that fall outside the parameters of what the program can provide, we make referrals to partner organizations and agencies. In addition, we make referrals for pet owners if they have their needs of their own beyond those of their pets. This can include referring them to programs that assist with services such as food assistance, pet-friendly housing, job placement, and more. We work closely with the NYPD and human service providers, including domestic violence and elderly care programs. With NYPD, CE works to prevent and combat animal cruelty across the 5 boroughs. The ASPCA cares for animal cruelty victims by providing medical and behavioral treatment, housing, and placement for these rescued animals. The ASPCA also assists criminal investigations managed by the NYPD and New York City's district attorney's offices through forensic evaluations, legal support, and training. We specifically support NYPD cruelty cases by removing animals from crime scenes and providing transportation of said animals to our 92nd Street facility where they receive the care and sheltering they need. Our program also receives case referrals from the ACC Community Pets Program. Our aim is to improve the lives of our city's pets and pet owners alike, and we look forward to continue working with fellow animal welfare individuals and organizations to accomplish this. Thank you.
Okay, next.
I'm Lucy Chaton, and I'm the manager for training and education of community cats at the ASPCA. We are here to highlight the urgent need for greater funding, access to affordable veterinary care, and overall support for the organizations that dedicate themselves to helping our city's most vulnerable felines. Supporting community cats involves a tremendous amount of behind-the-scenes work. Our program guides the public and rescue groups on cruelty referrals and works directly with law enforcement on such cases. We provide humane education to the NYPD and NYPD Explorers, supporting community cat work on the ground. Our program supports the community through education, training, and connections to outside resources. We offer workshops, both in person and online, to train community members and agencies on how to manage and care for community cats effectively. We recognize that there are very few outside resources available, and we urgently need more. Currently, just one person manages our community cats casework. Half the workload is field work and case management, which includes conducting site visits to assess conditions, gathering information, and developing intervention plans. The remaining half is dedicated to education and training, aimed at empowering the community to take proactive steps in managing community cats. It is important to note that the ASPCA does not directly provide trap, neuter, return, monitor services. To give you a better sense of the scope of our work with rescues, I'd like to share some stats. 892 rescuers are currently active with us. There are over 9,000 rescuers who could become active. And in 2023, we provided appointments to 46 different organizations and 116 individual rescuers. We provide a minimum of 600 free spay-neuter appointments monthly for community cats, including appointments for pregnant cats, which is significantly more than any other private organization. This September alone, we are offering approximately 1,318 free spay-neuter spots in New York City. There have been times when fewer appointments were available. This is not because we want to provide less support or see more unaltered community cats. It is simply because it is what our capacity allows. We have also provided funding for spay-neuter services to other groups to help bolster their efforts. We are grateful to all the rescuers who are making a difference, and we urge the Council to increase funding and access to affordable veterinary care for rescues and community cat programs across the city.
Thank you. Next.
Okay. Good afternoon. I'm Rena Lafai, Director of Administration at the ASPCA Adoption Center. Shelters and rescues nationwide are dealing with increased intakes, limited resources, and a shortage of veterinary professionals. Despite these challenges, ACC has maintained high placement rates and continues to create programs that support both animals and pet owners. We have a unique perspective on the challenges and successes of animal welfare in our city, and our partnership with ACC has been instrumental in this work. We provide ACC with grant funding for their innovative programs, spay-neuter services, and veterinary care for owned animals in underserved communities. We often transfer dogs and cats from ACC to the ASPCA Adoption Center, providing these animals with the specialized care they need to transition into new homes. We've provided nearly $9.5 million in grants to ACC to advance efforts to reduce euthanasia, increase adoption and placement numbers, and improve access to care for the city's most at-risk animals. ACC established a special case advocate team funded by the ASPCA, which includes 2 full-time staffers with social work backgrounds who work to keep people and pets together by offering resources and support to families and pets who may be temporarily separated. At the ASPCA Adoption Center and Kitten Nursery, we focus on giving second chances to the most vulnerable animals and those who typically stay longer in shelters. In fact, since 2014, the Kitten Nursery has supported more than 11,000 kittens, providing life-saving care during the peak of kitten season, which is right now during the warmer seasons of the year, when shelters are overwhelmed with newborns. Many animals come to us through our valuable partnership with the NYPD from our community engagement program or as transfers from ACC and often require extensive medical or behavioral rehabilitation. By providing the care they need, we help to alleviate the burden on ACC, giving them the chance to help more animals. So in closing, the support of this committee and the City Council is essential in making sure that ACC and other animal welfare organizations have the necessary resources to continue their life-saving work. Thank you.
Thank you. Councilmember Brewer, did you have?
Very quickly, because I know time is of the essence, but obviously when we asked earlier, what are the barriers to having fewer individual animals in the shelters? It was funding, obviously. It was housing for the person because they are losing their housing or their job. Are there any legislative or other ideas that you might have that would reduce the population?
So I'll say, aside from funding, we should take sort of a big picture look at it, and we'd love to work with the council to brainstorm on how to encourage and incentivize more pet-friendly housing. Because when you look at the animals in our shelters and in ACC, they're over 25 pounds, they're mixed breed, and so much of the housing in New York City prohibits anything over 25 pounds. So automatically there, we're cutting off places and homes that animals could go into. So we'd be happy to speak offline about what we can do to protect tenants that are already in place with their animals, and what we might be able to do to incentivize private landlords to be more pet-friendly to their
Thank you. That would be very helpful. I know NYCHA, that's an issue also.
Yes.
Thank you very much. Thank you, Madam Chair.
Councilmember Holden?
Yes, thank you all for your work on behalf of animals, and you're doing God's work, and I thank you all. Just a question, Lucy. You mentioned about there's over 9,000 rescuers who have an account, an RSS account, and could become active. What's preventing it? Funding?
So currently, our capacity is such that we cannot onboard new rescuers. The rescuers that are active with us, I mentioned, are 892.
Right, which if we had those 9,000, that would certainly help. But
Yeah.
How much money are we talking about? Because the council has to know, if we're going to a budget season, how much should we allocate to the health department, to ACC, to your organization, the ASPCA? How much should we do?
So sorry, Lucy, I'll jump in here. So we have that 800 figure is folks that have signed a rescuer agreement for this year. The 9,000 is the universe that has been, and if they were to renew, it could activate. One of the things I'm going to highlight is that the funding that the ASPCA, we can provide low-cost spay-neuter to owned pets that comes out of that Animal Population Control Fund. But state law limits, it says it only can be owned pets of individuals on public assistance. So unfortunately, that funding cannot be used to help rescues. So that's the legal restriction on how that funding could be used. So we would love to work with you to think about creating different sort of revenue streams that can go to help the rescue community.
Great. Thank you. Thank you, Chair.
All right, thank you. Thank you, panel. We really appreciate the work that you do. Thank you. Wait, I'm sorry. Councilmember Ariola did ask me. I'm sorry.
Yeah.
She did want to say something.
I also just want to thank you for the work that you do for animals, and also let everyone know that our office funds 2 buses, as does Councilmember Holden's office. One is for vet clinics and the other for spay and neutering. And I invite my colleagues to really, because it certainly isn't enough, and it's not enough time, and we can't do enough animals, when the buses come, to please invest your discretionary money, your initiative money, whatever you have, in these services that go out into the community and help our rescuers and help our local citizens to spay and neuter to their animals and animals that they have trapped to be neutered and released. So thank you.
Okay, now thank you, panel. All right, the next panel is Dr. LaCheryl Bao, Natara Luce, and Matt Miller. You can proceed.
Hi, my my name is Dr. LaSherle Ball, and I am the Director of Surgery at Flatbush Veterinary Clinic. I have more than 7 years of experience as a high-quality, high-volume spay-neuter surgeon and have performed approximately 40,000 surgeries for New York City pet owners and rescuers. I greatly appreciate the chair and the members of the committee for convening this hearing. I have worked with several spay and neuter organizations, and the common thread I have observed is the passion, enthusiasm, and urgency that teams across this city have doing this work. Although my colleagues and I are deeply committed to addressing the pet overpopulation crisis, we cannot do this alone. This work takes a heavy physical and emotional toll on us. Those that have pursued spay and neuter as a career shoulder the push to do as many surgeries as we can daily, and many of my peers have considered permanently leaving the field after being overworked and underpaid while witnessing suffering and neglect on a daily basis and feeling that there is not enough support for there to be an end in sight. And this has led me to my greatest passion of teaching. In realizing that I may not always be able to perform 40 surgeries a day, I decided that one of my contributions to the access to care issues we face would be to arm as many veterinarians as I can with the skills to do this important work. I'm a veterinary training specialist, and I have trained more than 60 veterinarians so far to perform high-volume surgery. Even still, we cannot tackle this crisis without long-term financial investment from the city. With your leadership and support, we can ensure our colleagues receive fair compensation for providing life-saving services. We can train more veterinarians to increase spay and neuter capacity in New York City. We can open more community-based, affordable veterinary clinics like Flatbush Vet in every borough. And by making basic veterinary services affordable and accessible, we can dramatically reduce shelter intake. But we must act. I know that you count on us as veterinarians to always be there for animals and people who need our care. Well, we're counting on you too. Thank you.
Thank you. Next.
Good afternoon. Thank you for the opportunity to testify. I'm pleased to see so many people advocating for animals today. My name is Matt Miller. I'm a veterinarian who's been in this field for over half my life, the animal welfare field over half my life, and I've been practicing in New York City for the past 5 years. I'm currently serving as the veterinarian for Muddy Paws Rescue, a nonprofit canine rescue organization that has pulled over 100 dogs from the ACC this year. One of my roles at Muddy Paws Rescue is to provide free dental care, spays, neuters, and other medical care for animals that in the care of NPR and partner organizations. Since I was 15 years old, I've been involved with animal shelters and rescue organizations, and I feel very fortunate to be a part of New York's animal welfare community. After all, animal welfare in the U.S. began right here with the ASPCA advocating against the mistreatment of horses in NYC in the 1860s. Here, I'm able to work with compassionate people developing creative solutions to overpopulation, and I empathize with many of the issues raised today. As an associate veterinarian, when I was in general practice, I had to turn away clients and their animals in need due simply to the inability to pay, and it broke my heart every time. Despite some of the criticisms I've heard today, I deeply appreciate the unimaginably difficult work ACC does to reduce barriers to pet ownership so adopted animals can stay in homes rather than return to shelters. And access to veterinary care is just one component to the fundamental problem here, which is overpopulation. There are more animals than homes in New York City. Stray animals, of course, pose a public health risk as multiple cats have tested positive for rabies in recent years, along with parasitic and fungal infections that threaten human health. And so ultimately, for the sake of public health and to reduce the suffering of animals, stray animals must either be adopted or euthanized. And New Yorkers have shown up today to advocate for solutions that make one of those outcomes easier than the other. Whether through funding high-volume spay and neuter programs or stemming the flow of animals from breeders, solutions exist. Animal welfare organizations here and elsewhere have provided funding for high-volume spay and neuter operations in the form of grants, donations, and federal student loan forgiveness to recruit and retain veterinary staff. I look forward to supporting this council as they seek to improve animal welfare and would welcome invitation to any task forces or programs that arise from this hearing. I have ideas with respect to public-private partnerships, the building out of low-cost medical programs, and maximizing the utility of funding toward the shared goals of everyone in this room. Thank you for your time, and thank you to everyone who showed up today for animals.
Thank you. Next.
Hi, I want to thank the council members who are still standing here to listen to all of us here. I'm Nantara Luce. I'm a veterinarian with the Neighborhood Vet and also started Small Bites Rescue during the pandemic. With the most recent corporate takeover of veterinary practices, it has significantly impacted pet ownership and animal welfare. Historically, veterinary care was provided by independent private clinics that offer personalized services at more accessible prices. However, as practices have been consolidated into corporate chains, the cost of veterinary services have surged, leaving pet owners struggling to afford routine and emergency care. This has led to heartbreaking decisions to abandon pets on the streets or relinquish them to shelters. I personally started a rescue after witnessing these countless pets being abandoned due to medical needs. Through my own clinic, I was able to provide veterinary care at cost, saving numerous lives. However, even after finding loving homes for these pets, some of these adopters were forced to relinquish them due to the overwhelming cost of ongoing veterinary care. These pets should not suffer because of financial barriers. In response to the urgent need for affordable options, I've organized low-cost free spay-neuter clinics on my days off. Let me repeat, on my days off. I've also worked with organizations such as Positive Tales to help with their spay-neuter clinics as well. I shouldn't have to do this, but I see their struggle every single day. These rescues need more help. These rescue organizations are heavily burdened to take on not just spay-neuter services, but also advanced medical care that many pet owners can no longer afford. This additional demand restrains private, more affordable vet clinics like myself, which often step in to assess these rescues knowing they need our support. Unfortunately, these clinics like myself are feeling pressure while battling their own constraints, leading to emotional and mental burnout among staff focusing on delivering quality care. To combat this crisis, we must advocate for more affordable veterinary options and explore community-funded services. It's crucial that we come together, veterinarians, pet owners, and community members, to assure that veterinary care is accessible and sustainable for all, safeguarding the bonds between pets and their owners while promoting better animal welfare in our community.
Thank you. I have a question for you. My understanding is that in veterinary school, you don't get a lot of training in spaying and neutering. Is that correct?
Typically.
Okay, so that's something that we should look at as well, yes?
Absolutely.
Can you explain that so that people kind of get a sense of it?
Typically in veterinary school, students are only absolutely guaranteed to perform one full surgery throughout their 4 years before they graduate and go on to be practitioners in the field. They do not feel confident or experienced enough to do this work alone, and there's not enough mentorship. They need a lot more support.
In my vet school, which was quite a while ago, like 21 years ago, you had a certain number of people that basically fought for a spay-neuter clinic. So your rotation would be 3 weeks, in which we would do like up to 20 or 30 spays and neuters during that time. But that would be like basically a lottery. So if you were a fortunate vet student to get that, then you would get more spay-neuter experience. But my spay-neuter experience has come through Terra, which was upstate, and that's where I got all my spay-neuter experience.
Do you want to give a pine on this?
Yeah, essentially, my experience was pretty similar. I mean, I went to vet school in the South in Auburn, Alabama, and there were quite a few shelters that were eagerly willing to offer up their stray animals for vet students to practice. So I didn't have the same issue getting experience, but it is certainly true that you are not guaranteed much more than one surgery at most vet schools.
So maybe we can offline get together and talk about that and see what we could do about the veterinary schools to make sure that they have this available so that they train vets to do this so that we can get more done, right? Yes.
We would love that.
Okay, great. Thank you so much. Really appreciate the panel.
All right. Thanks. Good job.
You as well.
Next panel is Rachel Zering, Justin DeSola, Allie Taylor. Hey, Allie, let's go. Will Zweigart, I'm sorry if one is that it's hard for me to read the handwriting, and I also don't pronounce very well either. Isabel Klee and Heidi Sisto. That's that. Okay, who's going first? Yeah, okay, go ahead.
Is that me?
Oh, go ahead, you may begin.
Oh, thank you.
Hello, my name is Isabel Klee, and I have been lucky enough to work with New York City animal rescues and shelters for almost a decade. I fostered 12 dogs in the past 12 months, and most of them have come through Muddy Paws Rescue from the ACC. I share my fostering and volunteer experiences on social media, where I have grown a relatively large audience. Sharing these stories has been wonderful and powerful, but of course with everything there is a dark side as well. I get comments referring to the ACC as a kill shelter, and as a person who has worked with countless rescue organizations around the world, I can confidently say that this choice in words is extremely harmful and misguided. The Animal Care Centers of New York City is an open intake shelter, meaning they cannot turn animals away. It is the shelter that serves the city that we all love so much. The ACC takes in every animal that comes to their doorstep. They take in strays, medical cases, owner surrenders, behavioral cases, and hospice dogs. In August alone, they took in 1,163 animals, a staggering number. Unlike many shelters that claim to be no-kill, they don't get to choose what animals come into their care. Open intake shelters like the ACC are arguably the shelters that need the most support. I've had the opportunity to spend countless hours at the ACC over many, many years. What I see are staff members who work incredibly hard. They are overworked and underpaid. They are doing the best they can with the resources that they have. Every single hallway is filled with pop-up kennels, and every single office has a dog. They're saving as many animals as they possibly can. I agree that something needs to be done about the animal crisis in New York City. We need more funding, we need free spay and neuter clinics, we need education about pet ownership, we need to provide resources to the organizations that are doing the work, we need to crack down on breeding regulations. The answer is not to attack the ACC, but to fix the fundamental overpopulation issue at hand. I am so proud to support New York City's rescue organizations in a way that uplifts them to do even better instead of shaming them for not being the absolute best.
Thank you. Next.
Thank you. My name is Justin. I'm the CEO of Astoria Animal Society in Astoria, Queens. My non-for-profit animal clinic helps. My non-for-profit animal clinic does low-cost spay and neuter. I roughly do about 200 a month, and we only do surgeries on Wednesdays. With the extra funding, I do believe I can help more days, more surgeries. We do see a lot of rescues coming in. It's very hard to book to everybody with no funding. I come up with as much as possible out of my own pocket to help. We're understaffed. It's a big issue with the population. We have a lot of private and non-private clients that comes in, but the majority is a lot of rescues. And if we can get funding and help, we can actually save a lot of more animals. Especially we do free distemper, rabies, and FERCP for the cats and canines. And that's pretty much it.
Thank you. Allie?
Good afternoon. My name is Allie Taylor, and I serve as the president of Voters for Animal Rights, a volunteer-run organization based in New York City. I also dedicate my time to rescuing cats in my neighborhood in Bushwick. I want to express my sincere gratitude to Councilmember Schulman, Speaker Adrienne Adams, and the Committee on Health for convening today's important hearing. And also thank you to Councilmember Justin Brannan for introducing new legislation aimed at tackling the issue of backyard breeders. This hearing represents a crucial opportunity for the animal rescue community to share our lived experiences and to collaborate with the City Council on meaningful, pragmatic solutions for both humans and animals. Today, we will hear from representatives of over 350 animal rescue organizations caring for dogs, cats, rabbits, guinea pigs, wildlife, and more. We will hear from community cat colony managers, veterinarians, shelter staff, volunteers, and pet parents. Our collective efforts are driven by a deep commitment to our community, our neighbors, and the animals we share the city with. Despite our dedication, we face significant challenges. The high cost of spay-neuter procedures and vet care, combined with inadequate support from our city government, has created a dire situation. We are urging the New York City Council to invest substantial and ongoing funding for high-volume, low-cost spay-neuter services and affordable veterinary care for all New Yorkers, including rescuers and pet parents. Over the past 2 years, many of us involved in animal rescue, particularly those focused on cats, have been getting organized, and we've been meeting with city council members to advocate for accessible spay, neuter, and vet care. It is surprising to many council members that when a constituent calls their office seeking help with stray cats, whether they are pregnant, sick, hungry, or cold, there is no city agency available to provide immediate assistance. Instead, the responsibility falls on volunteers like myself and the others present today. And this is not a knock on ACC by any means. They provide brick and mortar shelter services and many other programs, but they do not have the financial and staffing resources to go out into the field and rescue every cat or dog that needs help in that moment. Instead, consequently, constituents have three options. They can, one, do nothing and allow the cat to continue suffering and reproducing on the street. They can address the issue themselves using their own resources. Or three, they can reach out to numerous volunteer-run rescuers in hopes of finding help. We are an under-recognized, all-volunteer workforce providing a vital municipal service without compensation, often incurring personal financial strain. This system is unsustainable. Imagine instructing city workers to maintain clean streets and repair potholes, but without pay and with only their personal funds and equipment to use. This is the reality for animal rescuers in New York City. Additionally,
Can you just wrap it up, please?
Yeah. Additionally, thousands of compassionate New Yorkers have become certified rescuers, yet due to the severe shortage, they are not able to assist effectively. Expanding this service, currently there are only about 12,000 such appointments available annually, and to effectively address the outdoor cat population, we need at least 100,000 appointments annually. And if we were to include low-income pet parents as well, that would be 200,000 per year. For context, New York City's Department of Health allocates only $2.89 per capita for animal care, whereas LA invests $10 per capita, Miami-Dade $13.70, and Dallas nearly $15. The City Council can make a significant impact by creating incentives for veterinarians to obtain training in high-volume spay-neuter and by funding the expansion of these services across all boroughs. I look forward to the day when every one of the 51 City Council districts has access to such low-cost spay-neuter and veterinary care clinics. Thank you.
Thank you. Next. Please, and I'm just going to say, please keep to as close to the 2 minutes as possible. Appreciate it. Thank you.
Hello, my name is Heidi Sisto, and for the last 15 years I've lived in Bed-Stuy, Brooklyn. It was approximately 11 years ago that I started helping the stray cats in my neighborhood in my free time after being confronted with cats in need every time I left my house. Getting these homeless cats veterinary care, spay and neuter, and adopted into homes, spending any extra time and money I had on them. Like all cat rescuers, I had a day job that had nothing to do with cats and spread myself thin, juggling both my job and helping cats. It was around this time 11 years ago that I also started posting on social media, documenting the cats I was helping in my neighborhood. Since then, I've rescued over 1,000 cats, of which almost all were originally intact. In documenting this, I've garnered 2.4 million followers across social media platforms, and as a result, I've been able to turn rescuing cats into my full-time job. I can say that I am one of the only New Yorkers who rescues cats as their day job. In 2023, I spent over $100,000 on veterinary care for cats, which I was able to fundraise through my social media platforms. But this is not a sustainable solution. No one should have to become internet famous in order to provide what should be a city service. New York City shouldn't need social media influencers to solve this problem when there are thousands of New Yorkers who want to step up, many of whom you'll hear from today. Every day, New Yorkers want to help the cats on their block and get their pets fixed, but the resources just aren't available to do so, and as a result, the overpopulation crisis of pets gets worse every year. But we can solve this problem by having widespread access to city-funded spay and neuter. Clinics in every borough where pet owners and rescuers alike could bring pets to receive free and low-cost spay and neuter. We need your help. We need New York City to step up and fund high-volume, affordable spay and neuter. Thank you so much for your time.
Thank you. Next.
My name is Rachel Ziering, and I'm the founding executive director at Muddy Paws Rescue. We're a foster-based dog rescue group, and we've been a New Hope rescue partner for ACC since 2017. To date this year, we've taken in over 100 dogs from ACC, 12 dogs from the ASPCA, many of whom originated at ACC, and 3 strays directly from the public. The majority of these dogs have been large dogs and seniors. Of the 96 dogs we've taken from ACC since January 1st, 15 were altered prior to entering the shelter, and 23...
You don't have to read so quickly. You could submit. We want to hear what you have to say.
talk
Just
fast
summarize
anyway,
it so that we can get the gist of it, and you can submit it because we are going to pay attention.
Okay. Of the 96 dogs we've taken from ACC since January 1st, 15 were altered prior to entering the shelter, and the rest, 23 were altered by the shelter, and the rest we altered in our care through private vet clinics or in the last few months using our own clinic. There are many reasons for this, none of which come back to a lack of care or dedication from any one individual at ACC, and most of which relate to the dog's health, scheduling, and the national shortage of vets and vet techs. Theoretically, we can utilize the A for free alter surgeries, but trying to get these appointments is much like trying to get concert tickets for Backstreet Boys in the 90s. For many years, we jumped through all the hoops to secure those appointments, but it wasn't sustainable, and we concluded that paying $300 to $700 for these alter surgeries at private vet clinics was worth it to reduce the time and energy we were putting into trying to secure the free appointments. For a long time, this meant that we had to very carefully pick and choose who we pulled from ACC and give priority to those who were already altered. In March of this year, we partnered with another rescue group to bring a vet on staff part-time, Dr. Miller, who you heard speak before, and we began doing our own surgeries in-house, and this has allowed us to say yes to far more dogs from ACC. In my opinion, these issues are far more complex than we could ever identify or address in a single hearing, and we would love to be a part of the larger scale solution to support New York City animals, whatever that might look like. That was the extent of what I had prepared for today, but I'd just like to add, in response to some earlier questions about adoption processes, Muddy Paws is a huge proponent of open adoptions and utilizing technology to support open adoptions, and we'd love to be a part of any task force or initiative related to this. We have implemented a registration process versus an application process, and while changing the verbiage isn't the only important part of this, it has made for a much more welcoming and accessible process for potential adopters. Thank you to everyone who's boots on the ground at ACC for saving lives daily, and thank you for letting me speak very quickly today.
Thank you.
My name is Will Zweigert. I'm the founder and executive director of Flatbush Cats. Our mission is to help reduce overcrowded animal shelters in New York City. Thank you to the chair and committee for this hearing. Behind every overcrowded, open admission animal shelter is a city that has not yet made basic veterinary services like spay-neuter affordable and accessible for its residents. Affordability is the top issue for New Yorkers. It's also the #1 reason why people are surrendering their pets to shelters and why many say they will never be able to adopt again. Intakes are up, adoptions are down, and currently less than 5% of the city's animal welfare budget supports upstream efforts like spay-neuter. We cannot rescue or adopt our way out of this crisis. So last year, with support from the public and this council, we opened Flatbush Veterinary Clinic, a nonprofit facility offering affordable spay-neuter services and preventative care for pet owners and rescuers, because spay-neuter is surrender prevention. Next year, we'll perform over 10,000 affordable spay-neuter surgeries, which will provide a massive benefit to reducing shelter intake. We built this clinic as a model to show you what is possible, because we need a minimum of 100,000 spay-neuter appointments per year to dramatically reduce intake numbers. Imagine the possibilities if we scaled community clinics like Flatbush Vet to every borough. And imagine this council as the catalyst that finally turned the tide and inspired the rest of the country to follow suit. Think of how many lives you will save and improve, because behind every city with a manageable shelter population is a group of leaders who made spay-neuter services more accessible for both pet owners and rescuers. This is a solvable problem. Let's get it done.
Thank you. So I have a statement and I have a question. My statement, I went to visit Flatbush Cats, and I'm very impressed with your business model, and so I have made a commitment to bring this to the Queens delegation for next year to see if we can do something like that in Queens. So, and Councilmember Areola has agreed to partner with me, and I hope that Councilmember Holden will do the same. See that? So, we're gonna do that for the Queens delegation, and I urge my other colleagues, as Councilmember Areola said earlier about an additional piece of this, that they try to do that for their boroughs as well. The question I have is for Ally Taylor. Do you want to, this is a softball for you, do you want to comment on DOH-MH's responses to the questions earlier today? And they have people here, so.
Okay, that's fine.
No, saying they're here to listen, but go ahead.
I want to say that I was surprised by their lack of preparation and lack of candor, but I'm not surprised. This is a pattern that we've seen from DOH for decades. I don't believe that DOH should have oversight over ACC because they do not care. They have shown that time and time again. It is unfathomable to me that they would show up to a city council hearing and when asked if they want more money for spay-neuter to basically say, nah, we're good. I hope that what you saw today is indicative that we absolutely need change. We need a city separate Department of Animal Welfare that would house ACC and that would provide services for rescuers and pet parents that we so desperately need.
Thank you very much, and thank you to this panel. Oh, I'm sorry. Councilmember Holden.
Yes, and I'd like to thank all of you. And Heidi, it's amazing what you've dedicated your life. My God, it's wonderful. And Will, if you can give us like a budget that we can put in, like the chair said, that we could spread the Queens, but also the other boroughs. We need it in every borough. But that's 10,000 spay and neuters. It's just amazing that you could do that many. That's what you're projecting for next year.
That is the ASPCA's research team has estimated more than double that. I was trying to give you a number that doesn't scare you too much. We actually need over 200,000 affordable spay-neuter surgeries. Trying to baby step our way into some solutions.
But that number is so encouraging that we can get to that point in every borough, or maybe a few in every borough. Then we'll finally get a handle on this. But I have to say, this is so amazing, the advocates that we have in front of us. Thank you so much.
Mm-hmm. Thank you all. Hidia, I think this is what it is. Cohen, Stuart Mitchell, Samantha Knox, Tanya Copeland, Libby Post, and Sassy Walker. You may begin.
Hi, my name is Tanya Copeland, and I'm the co-founder and president of Bronx Community Cats. We're based in the 14th Council District, and we would like to thank Councilmember Sanchez for supporting and recognizing our work through discretionary funding. In the last 4 years, we've fixed over 3,600 cats, including a record 1,138 in 2023 alone. Sorry, including a record 1,138 in 2023 alone. We were able to accomplish this with a team of diverse and motivated volunteers, primarily utilizing services provided by the ASPCA, as well as a few smaller private clinics. In response to the alarming number of friendly, socialized cats that we were finding in our trapping projects, we decided to allocate more resources to owned pets. Currently, 30% of the animals that we fix every month are owned cats. When it comes to spay-neuter, intensity matters. And by that, I mean it's not just the total number of cats that we're fixing. They have to be done, the surgeries have to be done quickly in order to derive the most benefit from it. Namely prevention of reproductive cancers. So the Bronx can't wait another 3 to 5 years for another nonprofit clinic. We really need innovative solutions immediately to address some of these issues. 40% of the pet owners in the Bronx still have unfixed cats. This is versus 7% in Manhattan. A few of our volunteers have young children, including my co-founder who has 2-year-old twins. And so we're trying to envision a future where it's not normalized to see outdoor free-roaming cats in large numbers, neglected animals, and we're hoping with the support of this council that we can see that to fruition. Thank you.
Thank you. Next.
Good morning, Council. My name is Hadia Cohen. I am the founder and CEO of Bronx Dog Haven, a nonprofit organization dedicated to resources development in Bronx community. We started off as a socialization group in Melrose Projects. We later on gradually became what you see today, which is now developing, rehoming, rescuing, spreading the word for spade and neutering. We also developed a pantry that we do once a month, and then we leave a month for emergency food. What we found is we work with people that own animals, and what we found with them is that a lot of them can't afford foods or don't know that regular kibble isn't the only thing that they can feed their pets. So we teach them how to cook for their animals. We teach them other cost-efficient ways to be able to keep their pets. We also rely on sister rescues and nonprofit organizations for help to be able to get harnesses, leashes, collars, and things like that so that they are able to keep their dogs safe. We also give out cages. I think our urgency is just, like she said, we deal with a lot in the Bronx, and we want to make sure that we have a lot more people that can get the help when it comes to surgeries instead of them just surrendering their pets and or just leaving them in the projects for people like us to then pick up, have to rehome, rehabilitate, and make sure that they can get the help that they need and hopefully find a good home.
Next.
Good afternoon, Council. Thank you for letting me speak on this very important issue today. My name is Stuart Mitchell. I'm from Brooklyn, New York. I'm a single father of 2 teenagers, Taj and Nazir. I'm an author. I also visit New York City schools to talk about the importance of having compassion for animals, and I share the importance of adopting animals rather than buying from breeders that cause a number of problems. I'm also an animal rights activist. I'm involved in animal rescue. That includes pigeons, cats, and other animals. I'm a cat dad. Me and my kids share our apartment with 3 rescued cats, Fern, Kamala, and Ali. I'm here today with many other animal advocates that include colony managers, feeders, shelter volunteers, veterinarians, and fellow pet parents. And we are here today to urge the City of New York to allocate substantial funding for high-value, low-cost spay and neuter and affordable veterinary care for anyone in need, including rescuers and pet parents, especially the many of us living in public housing. Back in 2021, my baby boy Kamala was sick with FIP, which is a life-threatening disease found in cats. Most cats die within 2 months of acquiring this disease, and death is almost certain if it's not treated promptly and effectively. I could not afford the veterinary bill, and I had to rely on friends, family, and social media followers to donate money so that I could pay the bill to save Kamala's life. I'm very lucky and fortunate to have a strong community to rally around me and save my baby boy's life. And not everyone has that privilege, and unfortunately, because we live in New York where everything is overpriced, from rent to grocery bills and seemingly never-ending inflation, nobody has thousands of dollars just laying around in case of an animal emergency. And by the way, between the vet visits and the medicine for my cat, everything came out to a little over $9,000. No parent or caretaker should have to deal with the stress of an expensive vet care bill when they already have enough on their plate to worry about, like getting their rent paid, clothing our children, putting food on the table, and taking care of utility bills. Our animals mean so much to us, and this is why we are here to fight so hard for them today. Council, you have the power today to impact so many lives in a positive way, human and animal. Low-cost spay and neuter will be such a huge relief for colony managers, feeders who are paying for this cost out of pocket. and who, by the way, are doing an extremely hard task of keeping down cat colony populations in the city due to breeders continuously breeding cats for profit, only to leave these animals to be neglected by those that purchase them and tossed out into the streets to fend for themselves. Without colony managers, the city would have a major crisis and an overpopulation of cats roaming the streets. And keep in mind, these colony managers are doing this out of their own pocket and on their own free time to get these cats fed, spayed, and neutered. And lastly, I just want to say this: cats and dogs and other animals are a huge part of our family and also a huge part of our community. And low-cost spay and neuter plus cracking down on backyard breeding will ensure that we can maintain happy pet homes and easy-to-manage colonies. Thank you.
Thank you, sir. Next.
My name is Samantha Knox, and I am the director of Itty Bitty City Kitties based in Rockaway Beach, Queens. In the last 10 years, the population in Rockaway has increased over 8% to nearly 125,000 people, one of the largest population increases in Queens. The median household income is $66,000, which is 14% less than the citywide median. With the poverty rate in Rockaway at over 18% and 14% of our population in public housing. Of that, 52% are pet parents. For all of those people, there are 2 vets. Neither of those vets offer any low-income assistance whatsoever. The basic cost of an exam is over $175. If you throw in spay and neuter, it's well over $1,000, which is too much for a family who's struggling to feed their children. With no access to locally or citywide affordable vet care, the animal population becomes unmanageable and explodes. Pets who are problematic or sick get surrendered to an already overburdened shelter system or abandoned, making more animals found on streets, parking lots, dumpsters, playgrounds, or in the boardwalk. It creates situations where pet parents who take in a few strays end up with more than they asked for. In January, I worked a case where a former NYPD officer couldn't afford to fix her 3 cats. 3 cats became more than 100 in her 850-square-foot bungalow. I worked a case with a man in Broad Channel, a veteran who couldn't afford to sterilize his pets. He had so many in his small home, he started to panic, and he started throwing live kittens in the trash and drowning them in Jamaica Bay. This is just the beginning. This is not the dog fights. This is not kittens used as live bait. This is not animals tied in bags found in dumpsters. I'm one person, I'm one organization, and I cannot shoulder the burden of spay and neuter for the entire peninsula of Rockaway Beach. While the wonderful Councilwoman Ariola and I have discussed options and plans for our area, neither one council member or one rescuer can enact these financial things without the help, physically and financially, of a city who can help us.
Samantha, I want to thank you for coming here today, and I have had the honor of coming to your rescue and seeing the work that you do. And if anybody ever wants to, Samantha runs an amazing show. I mean, it's an incredible place. Disabled cats, kittens, NICU. I mean, it's a full gamut. She does this all from donations and mostly from her own pocket. But I would just like to ask you a question. Risa Weinstock from the ACC stated under oath that every animal that leaves their care from ACC is spayed or neutered. Would you say that that was your experience with ACC?
It is not. Our organization is part of the ACC New Hope program, and while I primarily pull kittens underage, not a single animal that we have ever pulled from the facility, which is well over 100 at this point, has had any spay or neuter service or medical care or has been sent home with any medication or further follow-up.
Thank you. Were there other indiscrepancies from the testimony that you heard from the DOH-MH, Mayor's Office, and ACC that kind of really stuck out in your mind?
Yes, especially in regards to reporting animal abuse. Both of these cases, these hoarding cases, these, by the way, are 2 of the 45 cases in Rockaway Beach currently right now on my radar, where there are more than 100 animals in jeopardy. We've reported them, and we are directed to 911, and they close the ticket usually in under 30 seconds with no follow-up. We have reached out to the city for assistance, and the only answer we get from the mayor's office is to go to the aspca.org and find out resources there.
Okay. I want to thank you very much for your testimony, for coming out today. And I have a lot of rescues in my district, and we work very closely with all of them, and they do an outstanding job. And honestly, the only way, and many of you have said it, to really combat the issue of the overpopulation and strays and feral cats and people just dumping cats off is to have them sprayed and neutered. So you know what we need to work towards? Free spay and neuter for all animals in this city, not just some. If we have money to spend on things that do not benefit us, in which a lot of money is wasted here in the city, we can find the money for this, and we're going to fight for that. Thank you.
Thank you. Next panelist.
Hi, my name is Libby Post. I came down from Albany today. I'm the executive director of the New York State Animal Protection Federation. We represent all the animal shelters and a growing number of rescues at the state capitol. You've heard today all the reasons why the shelters are overwhelmed, so I'm not going to get into that as well. But these dynamics are beyond the control of any one shelter, but are being used to continue the demonizations of shelters as some organizations promote the concept that, quote, shelters kill animals. In 2023, the Animal Care Centers of New York, who's a Federation member, had a live release rate, as Risa said before, of 91%. Anything over 90% is considered, quote, no kill. Yet ACC is continually demonized by many as a kill shelter where animals are routinely euthanized. This organizational demonization, as well as the personal attacks on shelter staff, advocates, and elected officials, has to stop. We have become too inured of being able to just attack people in a way that's really destructive to them. Not only the people working in shelters, managing shelters, advocates, but also our elected officials. I can tell you that in Albany there have been death threats made to elected officials if they don't vote the way some animal advocates would like them to vote. And that's just not right. But we do know that by working together we can make a difference. I want to thank you for holding this hearing and beginning to do the work necessary to change local law to comport with the statewide ban on selling puppies, kittens, and rabbits in pet stores that comes into effect this year on December 15th. The Puppy Mill Pipeline Bill was a major victory for animal welfare. We've seen other major victories in the past few years as well. On the same day that Governor signed the Puppy Mill Bill, she also signed the Companion Animal Care Standards Act for Shelters and Rescues, which takes effect on December 15, 2025. This measure raises the standard of care across the board at all shelters and rescues. Simply put, ACC and all shelters and rescues in New York City will be inspected by the New York State Department of Ag and Markets. We have raised considerable grant funding to provide no-cost consulting services for shelters and rescues. The New York Community Trust has given us funds. We have 8 slots left for New York City organizations. If you are a bricks and mortar rescue or a bricks and mortar shelter, please get in touch. Go to nysapfedfund.org and sign up. Now, I know I'm going to be quick. The Standards Act works hand in hand with the Companion Animal Capital Fund. Since 2018, $33 million has been invested in capital projects at shelters across the state. ACC has gotten some of that money. Bidewee has gotten some of that money. This year, we're asking the governor to put $10 million in. She's put $5 million in for the last 2 years. Double it, and we'll be very happy and be able to move on to other things. Our annual capital needs survey has found 48 shelters across the state have capital needs of $77.2 million. While the fund doesn't cover everything, it really does help, and we've seen a great deal of change. The challenges to animal welfare in the city and state are many, but there are those of us in the policy trenches that are making headway and proposing new innovations. Getting serious about increasing low-cost spay and neuter services means getting serious about dog licensing. We all know a portion of each dog license goes to the state's Animal Population Control Fund, which then funds low-cost spay and neuter programs across the state. While I can't get into specific detail right now, the Federation is ready to discuss with the City Council in more detail outside of this context of this forum how we can enhance licensing in New York City. The other challenge we're all facing, as we've been heard, is the shortage of vets. The Fed is working with the Vet Society. We're doing a matching program to bring vets to shelters in need of those services. And people really responded pretty well. So thank you again for the opportunity to speak today. I'm more than happy to delve further into these issues with you as a group or individually.
Thank you. And next panelist.
Hello, everyone. Hi. First, I want to thank you guys so much for having this platform for us to speak. I've done this before a few years ago. Nothing came out of it, but this feels different. This feels like you guys are listening, you're asking the right questions, and I just have a really positive feeling about it. So thank you, and thank God for us all being here and healthy. A big shout out to all the rescuers here that made it. I know a lot of them, so you're going to hear some great testimonies. I want to first say my name is LaTanya Sassy Walker, better known as Sassy. I am a one-woman show. I am in Brooklyn and Brownsville area. I rescue in Canarsie and East New York. They're lower income. I'm a NYCHA resident. So I see it all, I get it all, and I feel it all. I don't have my notes because I'm too busy. Today I had to drop off cats at ASPCA. Yesterday was Cat Cafe, Flatbush Cats. Like, you know, I'm just every day. And I work a full-time job for New York City Health and Hospital. So I work there to support the cats, right? I've bounced so many checks. I was gonna bring you my bag of all the paperwork for just this year alone so you guys could get a kick out of it, but I was rushing and I forgot it. So I just wanna say, you know, I'm coming from the heart. Like, you know, I am the cat person, the dog person, the bird person, the rabbit person. I am called every day, all day. I am so exhausted. I am so exhausted that sometimes I say, I am running and leaving. I am leaving New York. I speak to people all over the world. They have free spay neuter. They don't go through all of this. It's like, why do I have to? Look, I don't even have my nails done. I don't dress up. I don't go nowhere. You know, all I do is cats. Cats. People be like, what you want? Okay, cat food, anything, you know? And it's like, I want a little bit of a life. I would love a little bit, just a little bit of me time. Go to the gym. Just do something nice. So this is all I do. And I'm also the feeder. I have to help 20, 30, 40 people who feed. The elderly are my specialty. They call me for everything. I would never tell them no. I will drop whatever I'm doing, give them my last. I also help the stray population. You know, so I'm going to sum it up and say what the solutions for me would be for NYCHA. I would like for them to start going back to the apartments and seeing what is being done with these dogs, and the breeding is out of control. You have to go in the apartments and see what's going on because it is ridiculous. I am dealing with the dog out of control. Also, I would like to see Department of Health. The stores used to let me fix